All right, we're on the record at 10:03 a.m. on May 21st, 2021. This is a Zoom recording of Dr. James Shiver. The court reporter is Bonnie Smith. Before we proceed, I will ask counsel to agree on the record that there is no objection to this deposition officer administering a binding oath to the witness remotely. Please state your agreement on the record, beginning with plaintiff's counsel.
James Botts, no objection.
No objection.
Alicia Lorraine, no objection.
And Dr. Shiver, would you raise your right hand? Do you swear the testimony you're about to give in this cause to be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
State and spell your full name.
James Michael Shiver. James, yes. You want me to spell my last name too?
Yes, please.
S-H-I-V as in Victor, E-R.
And your partner in Athens Family Medicine is Paul Haver, MD.
That's correct.
You also have a nurse practitioner named Hannah Green.
No longer. She's moved on to work with Piedmont ARMC.
All right. Any other physicians in your group, Athens Family Medicine?
No.
Any other nurse practitioners or physician's assistants?
There is a nurse practitioner that we just hired recently. Her name is Kelly Strickland. I don't remember her middle name.
All right. Kelly Strickland.
Yes.
And that's on Barnett Shoals Road in Athens.
It's 2205 Barnett Shoals Road, Athens, Georgia, 30605.
And you've been employed there since 1998?
Well, actually, when I came to town, my partner and I started it up, I guess, 1991.
All right.
But I did other things up until that time. I guess it was 98 when I went back and rejoined him.
And you've been working with Paul Haver, MD at Athens Family Medicine continuously since 1998.
That's correct. As far as I know, I think it was 98. It sounds right.
Yes, sir. And that's, if you don't know, it was as best as you can remember around 1998.
Yes.
And how many days a week do you work at Athens Family Medicine?
In the clinic, 5 days a week. What I'm gonna call 7 days a week.
And you and Dr. Haver cover for one another?
For our personal practice.
Do you have any other practices other than Athens Family Medicine?
No.
Does Dr. Haver have any other practices other than Athens Family Medicine?
Not that I know of.
Did you bring any documents with you here today?
Yes.
What did you bring?
Documents. There's a prescription record from CVS Pharmacy
Yes, sir.
of Shirley Couch. That was back between April and July of 2017. I have the copy of Dr. Park's records for Miss Shirley Couch.
Yes, sir.
I have the Piedmont ARMC records for Shirley Couch as well.
All right.
I have there's a handwritten administration record that was marked as an exhibit for, I presume, Renee Bonner's trial. I'm not sure about that, but I'm pretty sure.
It's a medication administration record in handwriting.
It's in handwriting and it's marked as an exhibit, and it's 11-0148-25-17.
Yes, sir.
And I've got the Homestead Hospice records for Shirley Couch
All right. Any other documents?
that I don't have them with me, or at least not on my computer. I opened up.
Yes, sir. And you reviewed those documents in preparation for your deposition here today.
I did.
And you were also employed by Homestead Hospice in Athens, Georgia, from January of 2013 until November of 2019. Is that right?
That sounds correct. I'm not positive about the exact dates, but I'm pretty sure it was 2013. And honestly, it seems like 2 years since I've worked for them.
All right. We'll get to this in a moment, but your resignation is dated 21 November 2018. And
Okay,
it reads something akin to after the first of the year, which would be
Okay.
2019.
okay. Yeah, that sounds right. Yeah, I don't have that before me.
All right. All right. Do you have privileges at the Athens Regional Medical Center?
I did.
You do?
I did.
Yeah.
I've dropped my privileges since I quit working for Homestead or Hospice.
All right. When you worked for a Homestead Hospice, do you remember when you were in medical school, did you ever do what you called moonlighting?
Not much in medical school. Actually none in medical school.
Your residency or training?
I probably did a very limited amount of moonlighting, maybe only once or twice back in my residency.
Yes, sir. And so your role as the medical director at Homestead Hospice was also a part-time job.
I would say it was a part-time job, yes, but I was pretty much on call 24 hours a day, 7 days a week.
Yes, sir. And who did you have cover for you at Homestead Hospice?
I don't remember people covering for me. I pretty much stayed on call where they could call me anytime they wanted to.
So in addition to working 5 full days a week at Athens Family Medicine, you were also taking call for Homestead Hospice 24 hours a day, 7 days a week.
Yes, I remember actually answering calls when I was on vacation.
Yes, sir. And you were also taking calls for your practice at Athens Family Medicine.
Yes,
And you understand that your deposition here today is a public document
yes.
and it can be viewed on places like YouTube.
I didn't know that, but okay.
And physicians that you work with can see this.
Okay,
Patients, potential patients,
sure.
nurses, colleagues. You're aware of that?
I am
By
now.
now. Have you had any conversations regarding this case with anyone other than your lawyer?
No. Well, in detail? No.
At all?
And well, just the fact that I think my partner knows that I'm being sued.
And that's Dr. Paul Haver, MD?
Yes, I believe he knows I'm being sued, and that it's related to hospice.
Yes, sir.
He doesn't know any details.
Any other conversations with anyone else regarding this case other than your lawyer?
My wife knows I'm being sued.
Anyone else?
Conversations. I think my cousin knows that I'm being sued. Not any details. Doesn't
Is your
know any
cousin-
names. Cousin?
Is your cousin also a physician?
No, he's a lawyer.
All right.
I can't think of anybody else.
Sir?
I can't think of anyone else.
All right. Do you know Mike Pruitt?
Mike Pruitt, that does ring a bell.
Have you spoken with Mike Pruitt about this case?
Not that I recall.
All right. Have you spoken with him at all that you recall?
Honestly, I'm trying to remember who Mike Pruitt is.
All right. Have anything, did you remember?
No,
Have your privileges ever been suspended or revoked?
no,
Ever been denied privileges anywhere?
no,
Ever had insurance non-renewed?
no,
Ever been a party to a medical malpractice lawsuit?
yes,
About how many times?
once.
When was that?
It was, I'm not exactly sure of the date. It would have to have been after the time that you said that I started working for this. That was like 1998,
All right.
and probably before 2010, probably in the 2005, 2007 range, somewhere in there.
All right. So between 98 and 2010, as best you can remember, around 2005, 7, something like that.
Yes.
And where was that case brought?
I'm not sure. It was ever, I received notification, I received had a lawyer, and the plaintiff dropped it. And I'm not sure, I cannot remember when it was actually brought, or exactly what county it was brought in.
Do you remember whether it was in Athens or Atlanta?
I was living here, I was served here. Yes,
You're not board certified in hospice and palliative medicine? You're not board certified in geriatric medicine?
no,
You're not board certified in bariatric medicine?
no,
You're not board certified in adult medicine?
adult medicine. I
Yes,
didn't know there was a certification for that. I'm not certified in adult medicine.
You're not board certified in emergency medicine?
No,
You're not board certified in internal medicine?
no,
You know Dr. Singh in Athens?
I do not know her. I know of her. I've heard her name. She's seen some of my patients and taken care of them while they were in the hospital.
You've referred her patients?
I don't know if it would be a referral, but it was a referral to the internist or the hospitalist. And I know I've seen her name on some of my communications back from discharge summaries and admission summaries.
Yes, sir. And are you pleased with the care that she provided your patients?
Yes,
And you're aware that she is board certified in internal medicine?
yes,
And you're not board certified in family medicine?
yes, I am.
You are board certified in family medicine?
I had a residency,
Yes, sir.
graduated residency in 85.
And
And then I'd been board certified, passed my certification things 4 or 5 times.
yes, sir. And
Currently, I'm a member of the American Academy of Family Practice. I don't think my board certification is current.
I'll show you what has been previously marked as Exhibit 1 to your deposition. This is a verification from the American Board of Family Medicine.
Okay.
Have you ever seen that document before?
Don't recall seeing it, no.
The American Board of Family Medicine, abbreviated ABFM,
Okay.
that's the family medicine board that you were referring to. Is that right?
Yes,
And according to the ABFM verification, you haven't been board certified since December 2015. Isn't that true?
yeah, that's what it appears to be, yes.
And that's true, right?
Right.
So when you said you were board certified a moment ago, that was untrue. Is that right?
Well, actually, I guess that's semantics. I have been board certified. I don't have current certification status. And you can see there, it looks like there's 4 times that I was certified in family practice. I'm still currently a member of the American Academy of Family Practice.
Yes, sir, but you're not board certified. Is that right?
Not since December 31st, 2015.
Yes, sir. You're not board certified in any specialty. Is that right?
No,
Now, do you remember testifying in the criminal case for Carla Renee Bonner
yes, I do.
when you were under oath at that time
Okay,
and you testified truthfully?
yes, I did.
I'll show you what's been previously marked as Exhibit 2 to your deposition.
Yeah, I
This is
can see that.
expert of your trial transcript. Can you see that all right?
Yes,
And when you were asked whether you were board certified in a superior courtroom in a criminal trial, you testified, yes, sir, that you were.
yeah, that was an error.
Yes, sir. And that was in February of 2019.
I'm not sure when that was.
The date of the trial transcript is February 2019. Any reason to believe that February 2019 is inaccurate?
No,
Okay. So have you testified when you were asked, are you board certified in family medicine? And you answered, yes, sir, in a courtroom from a witness stand under oath? That answer is inaccurate.
yes, that answer is inaccurate. But
It's untrue.
if,
Sir?
I would say that at the time, what I was answering was if I had been board certified. And I made an error in saying that.
Yes, sir. And when you first answered me today, you made an error as well. Is that right?
Yes, that's because I look at the board certification as something that I have done.
Yes, sir. Are you aware of the nature of the oath you took when we started this deposition?
Yes,
Okay. And are you familiar with what's called the penalty of perjury?
yes,
All right. What is the Karnofsky performance scale?
I don't know.
Do you have any idea what the Karnofsky performance scale is?
No, I don't.
So it's safe to say you've never used it, right?
No. Yes, it is safe to say I have not used it, at least knowingly. It might be known by some other name.
KPS, you ever used anything referred to as KPS?
No,
Are you familiar with the Riceburg Functional Assessment Staging Tool?
No,
Never used that either, right?
no,
You know what the FLAC score is? Have you ever used that?
yes.
And what is that?
It's a level of, or basically a way of determining a patient's level of pain based on what they're, how they visually are reacting and
Yes,
how they're
sir.
responding to you.
And how many categories of the FLAC assessment are there?
I think it's FLACC,
Yes, sir.
so it'd be 5 categories.
Have you authored any textbooks?
No,
You authored any treatises?
no,
You authored any chapters in any textbooks?
no,
You authored any peer-reviewed articles?
no,
Have you authored any non-peer-reviewed articles?
no,
Have you authored any grand rounds?
no,
Authored any throwaways?
I'm not sure what that is.
Did you ever give a presentation in your residency program?
Not that I can recall.
All right.
I've presented patients at grand rounds and to other physicians attendings, but I don't know that I did any kind of formal papers or talk.
You're not board certified in anesthesiology
No,
or pain management?
no,
Now, when you were employed part-time at Homestead Hospice from January 2013 until 2019, you prescribed drugs.
I did.
You were the medical director.
And I was.
You agree that that's the captain of the ship,
Yes,
that the buck stopped with you?
I believe I was responsible for the patients on
Yes, sir.
service.
And you had an agreement to that effect?
An agreement?
You also had a job description with your responsibilities. Is that right?
Yes, yes.
I'm going to show you what's been previously marked as Exhibit 3 to your deposition. Exhibit 3 is your professional services business entity contract with Homestead Hospice that
Okay.
commenced on January 8th, 2013.
I see that.
Is that right?
I see that, yes.
And that's your signature on the last page?
Yes,
If you look at page 2, item 1, there's a reference to a physician services fee schedule, addendum A. You see that?
it starts with upon request from hospice.
Yes, sir.
Okay.
There's not an addendum A to the physician services agreement that we were provided. Was there an addendum A to your original agreement with Homestead Hospice?
I have no idea.
All right. How were you paid by Homestead Hospice?
Check. I think it was deposited.
All right. Were you paid weekly, monthly? How are you paid?
I'm not sure. And I don't actually recall how much it was either.
Yes, sir. Were you paid per patient, per hour, per
No.
month, per week?
No, it would have been on a per month, but whether it was actually dispersed per month, I can't remember.
There
It
was
could
a
have been
set-
every 2 weeks, but I'm not sure it's any more than that. Is it probably every 2 weeks, maybe monthly? But it would have been the same amount.
It was a set fee. It did
Yes.
not matter how many patients you saw
That's correct.
or how much time you spent there.
That's correct.
And if you read down, you see item 4. Business
It is-
entity, that's a reference to you, right?
Yes,
And it reads, this is a contract for PRN services as needed. And what does PRN mean in medical parlance?
as needed.
Yes, sir. So you provided services as needed?
I provided services 24 hours a day, 7 days a week.
Yes, sir. And nobody to cross cover you?
No.
And-
Possibly, it was offered that the assistant director would cover me if needed.
Yes, sir.
And I'm sure that if I was unable to be reached, then they would call the assistant director, but I'm not sure if that ever happened.
And how can you be sure about that if you're not sure that ever happened?
Because I remember being offered that by the assistant director. I think it was probably in reference mostly to like going on vacation and stuff, but that's,
Otherwise, you were on call 24/7.
yes,
And if you see paragraph 10, this was a 2-year contract.
uh, that's correct.
And then under paragraph 11, if you chose not to renew it, you need to give at least 30 days notice. Is that right?
Yes, or they could let me out, I believe.
All right. And then you resigned in November of 2018. Is that right?
Okay, I think that's the right timing. You had a copy of it. I'm not sure what the date was.
Sure. Show you what's been previously marked as exhibit swore to your deposition? Is that a copy of your resignation letter to Myron Paulk at Homestead Hospice?
It appears to be.
And that's your signature at the bottom?
That is.
And that's on your Athens Family Medicine letterhead,
Yes.
where you had your full-time job
Yes.
and your partner was Paul D. Haver, MD.
That's correct.
And it reads, Dear Myron, I've been with the Homestead for quite a few years. That's what you wrote.
Yes.
It goes on to read, I've enjoyed helping our patients and working with the nurses and other Homestead staff, but the professional and personal time it takes to be the director is consuming more and more time. That's what you wrote.
That's correct.
It is also occupying my office staff to a greater degree as well.
Okay.
That's what you wrote, right?
I did.
And by that, you mean your office staff at Athens Family Medicine?
Yes.
Your full-time practice with Paul Haver, MD?
Yes.
It also reads the salary compensation is just not adequate.
Hmm.
Yes?
That's what it says.
Yeah, we all do that. It's very difficult for the court reporter to take that down. So along the
Sorry.
way, if you do
Sorry.
that, it may remind you that we'll need a yes or no.
Yes.
So the bottom line is you weren't being paid enough.
It was a gradual thing over time. Initially, the compensation seemed more than adequate.
Yes, sir.
By the time, at the end of the time, it didn't seem to be as suitable amount.
Yes, sir. And it reads the compensation would need to be raised to, and that's blank. Did you take that number out?
I don't recall doing that at all. No.
What was that number?
Don't answer that, Dr. Shiver.
Okay.
You're refusing to answer that question?
His financial status as a defendant is irrelevant to this case. It's confidential and it's proprietary. It was removed apparently by counsel for Homestead Hospice in the production of his personnel file without, in order for the court deeming his financial information that is again private and confidential be relevant to this case. In a confirmation of that, I'm instructing him not to answer.
Are you refusing to answer?
On the advice of counsel, I'm refusing to answer.
Goes on to read, I will not be continuing my associating with Homestead after the first of the year. Sincerely, J. Michael Shiver, MD. That's what you wrote.
Yes.
And since this is dated 21 November 2018, that means at the first of 2019 is when you ended your association with Homestead Hospice.
That's correct.
Now, between 2013 and 2019, your office manager was Carla Renee Bonner.
No.
Who was your office manager?
I'd have to, it was several, but it was never Renee Bonner.
What was Renee Bonner's role
In my office? None at all.
in the Homestead Hospice office?
I'm not sure.
All right. You didn't have,
She was in the administrative section. That's all I know.
yes, sir. You didn't have a physical office at Homestead Hospice, did you?
No.
How far was your office from Homestead Hospice's office?
One side of town to the other, I'd say 4 or 5 miles.
Did you know the address of the Homestead Hospice office?
I think it was on Linroo Road, but I don't recall anything else.
Yes, sir. And how often were you physically present there?
At least every 2 weeks, sometimes a little more than that.
So roughly twice a month, sometimes 2 or 3 times a month?
I would say that's accurate.
How many patients did you have at Athens Family Medicine?
I don't know. I could give you a guesstimate. And these would be probably shared by my partner, maybe 4,000 to 5,000, something along those lines.
Yes, sir.
And not all of those would be active.
I understand. But at Athens Family Medicine, between you and one other partner, you had 4,000 to 5,000 patients?
I guess that's an estimate.
So that's your best estimate, right?
Yes,
And not all of those patients were active, though? Is that right?
I'm sure. I mean, basically, we consider an active patient we've seen within the last year.
Yes, sir. And
So there are plenty that drop out.
about how many of the 4,000 to 5,000 patients you had at Athens Family Medicine were active patients?
I have no idea.
Half?
I wouldn't know.
All right. Who would know?
I don't know that anybody would know.
How many patients per day on average did you see at Athens Family Medicine?
When? Because it varies quite a bit.
From 2013 to 2019.
2013. It could be anywhere from 10 to 20 patients a day. That's a very rough estimate.
How many patients do you see per day now?
Usually around 20, maybe more, maybe less.
20 more or less?
Yes.
And you were also seeing 20 more or less in 2016?
I don't really have any accurate way to estimate that. I'm just guessing. I know that when I first started back up in your notification of 1998, I might have seen 2 or 3 a day. It gradually increases over time.
Yes, sir. 1998 to 2013, though, is 15 years, is it not?
Right. Yes, I would say that that the lower end of what I said, 10 a day, would probably be a minimum, but I wouldn't notice for sure.
Yes, sir. I mean, how much has your patient load at Athens Family Practice changed in the last 5 years?
My load in the last year has significantly increased.
Yes, sir.
That's because my partner is not able to participate in the practice. So I'm seeing his and mine. Before that, 15 a day. I don't know.
But when you began to work at Homestead Hospice, you also had a job description?
In reference to what?
You had a job description?
At my office or at
At Homestead
Homestead?
Hospice.
I'm sure they provided me with something, yes.
Right. Show you what's been previously marked as exhibit. Is that 5, Madam Court Reporter?
5, that's correct.
Thank you. You ever seen that document before?
It's got my signature on it. I don't recall it, but looks like I have.
But that's your signature on the 4th and final page, right?
Yes,
And you signed that on January 11th, 2013.
yes,
And on the first page, it's entitled Job Description, Medical Director,
yes,
Reports to Chief Executive Officer.
yes,
And you were the medical director for Homestead Hospice.
yes,
For your entire time there.
yes,
And you see here where it reads qualifications.
yes,
It says eligibility and or certification by the American Academy of Hospice and Palliative Medicine desirable. Willingness to obtain certification within 3 years is required. Do you see that?
yes, I do see that.
And that was there when you signed this on January 11th, 2013, true?
I was there, yes.
And you never became board certified by the American Academy of Hospice and Palliative Medicine, true?
No, I did not.
So you did not comply with that qualification requirement 3.
Object to form.
You may answer.
No, I am not certified in American Hospice or Palliative Medicine.
Yes, sir. So you did not comply with qualification 3 in your job description, true?
Object to form.
No,
You see qualification requirement 4, at least 2 years hospice experience.
yes,
I reviewed your CV and I didn't see any prior hospice experience. Did you have 2 years prior hospice experience?
not as a hospice director.
Yes, sir. Well, where did you have any hospice experience?
Through my private practice for the last 30 years.
Well, your private practice is in family medicine, true?
True, but I take care of hospice patients periodically, yes. My own patients in hospice.
Has your practice ever been called a hospice practice?
No,
Has it ever been called a palliative care practice?
no,
Has it ever been called a hospice and palliative care practice?
nope,
Is your partner board certified in hospice and palliative care medicine?
no,
Is he board certified in geriatric medicine?
no,
Is he board certified in bariatric medicine?
no,
Is he board certified in pain management?
no,
Is he board certified in anesthesiology?
no.
Does he have any board certification?
He has a board certification in family practice.
Yes, sir. You agree that family practice is not the same as hospice and palliative care?
There is a difference.
Yes, sir. And thank you for answering that. My question's a little different. You agree that hospice and palliative care is not the same as family medicine?
Object to form.
I'm not sure that I agree with that. I think that taking care of the patient, administering to the patient is the same.
All right, so you agree that a hospice and palliative care practice is the same as a family medicine practice?
No, I do not. I'm saying that the care provided to the patients is the same.
The care provided to what patients is the same?
The patients that I'm taking care of.
You provide the same care to your patients at your family practice, family medicine practice, as you do at your Homestead Hospice practice?
If I have a patient that is dying and qualifies for hospice, and I take care of that patient, then I'm providing the same care. Yes.
Do you prescribe in your practice opioid naive patients, opioids and benzodiazepines?
Object to form.
You may answer.
I have prescribed opioids and benzodiazepines to patients in my practice. Yes.
All right. And you do that to opioid naive patients?
Same objection.
I have prescribed opioids to opioid naive patients. Yes.
And you've prescribed opioids and benzodiazepines to opioid naive patients, true?
Object to form.
I'm sure that in the course of my practice, I've had patients that have been on benzodiazepines for whatever reason. And
Yes,
that
sir.
I have, I'm still talking. I said, I have started people with that and then started patients who have never been exposed to opioids. I have prescribed those patients opioids for whatever reasons. Usually it's going to be in response to pain. Yes, I've done that. And they were at the time opioid naive.
Would you like to move to strike as non-responsive? Madam Court Reporter, would you read back my question, please, ma'am?
Question, and you prescribed opioids and benzodiazepines to opioid naive patients, true?
Same objection.
I know that I have had patients in my practice that I have prescribed benzodiazepines and opioids, and they have been opioid naive. I'm not sure of any other way to answer that.
And you also prescribe those patients fentanyl?
I don't recall an exact case, but I have prescribed fentanyl to patients in my practice, but I've never prescribed it to an opioid naive patient. No.
All right. And why have you never prescribed fentanyl to an opioid naive patient in your family medicine practice?
Family in that practice or in hospice? Because it's not the appropriate stepwise progression of pain relief.
Yes, sir. You agree that fentanyl is a dangerous drug?
Fentanyl and pretty much any drug you take into your body is dangerous.
Yes, sir. And you agree that prescribing fentanyl to an opioid naive patient is also dangerous?
I have never prescribed fentanyl to an opioid naive patient.
Yes,
It
sir. And-
would, I'm completing the
Yeah, that's
question,
not my question though.
but I'm gonna finish completing the question.
What?
If I am in the process of finishing my answer. So I don't believe it's appropriate to start fentanyl in an opioid naive patient. I can conceive of a time where that might be possible, but I don't know that it's a realistic hypothetical patient. It'd have to be somebody that in an unusual circumstance. All I can tell you is I've never done that. I'm not sure why you would. Does that answer your question?
Objection moved to strike as non-responsive. Madam Court Reporter, would you read back my question, please, ma'am?
Question, yes, sir, and you agree that prescribing fentanyl to an opioid naive patient is also dangerous?
Object to form, asked and answered. You can answer it again, Dr. Shiver.
It would be dangerous to prescribe fentanyl to an opioid naive patient.
Yes, sir. It would also be dangerous to prescribe both fentanyl and an opioid to an opioid naive patient. True?
Object to form.
If, yes.
It would also be, go ahead.
Fentanyl to any opioid naive patient can be dangerous. You'd have to monitor them very closely. And benzodiazepines would complicate that.
It would also be dangerous to prescribe at the same time fentanyl and an opioid and a benzodiazepine to an opioid naive patient. True?
Object to form.
Say that again.
Could you read it back, please, Madam Court Reporter?
Question, it would also be dangerous to prescribe at the same time fentanyl and an opioid and a benzodiazepine to an opioid naive patient. True?
That is correct.
It would also be below the standard of care to prescribe fentanyl to an opioid naive patient. True?
Object to form.
You may answer.
What standard of care? Just a medical standard of care?
Yes.
I wouldn't think that it would be appropriate or standard of care to prescribe fentanyl, long-acting opiates, to an opioid naive patient.
Yes, sir.
I think that it is not inappropriate to prescribe benzodiazepines to an opioid naive patient. And I don't think it's inappropriate or reflects on standard of care to prescribe a short-acting opiate to an opioid naive patient, because if you need to give them pain medicines, you're going to prescribe them the opioid. And if they've never had it before, then they're opioid naive. But that's an appropriate way to prescribe opioids, short-acting opioids.
Dr. Shiver, you agree it's below the standard of care to prescribe fentanyl to an opioid naive patient? True?
Objective form.
I can say that I don't know what the circumstances be, but if a patient was unable to take medications by mouth and was unable to receive parenteral therapy, opiates, to help relieve pain, and they were in a great deal of pain, I can see where a small dose of fentanyl might be prescribed with close association or attention to vital signs, especially respirations. So I can't say that I agree that every circumstance means that you could not, or it would be below standard of care to administer it to a patient. But I've never actually seen that circumstance.
So your testimony is within the standard of care to prescribe fentanyl to an opioid naive patient. True?
Objective form.
I'm saying basically what I just said. Could I ask the court reporter to repeat it back?
It's not, it is, or it is not within the standard of care to prescribe fentanyl to an opioid naive patient.
Same objection.
I thought I just answered that question.
It is, or it is not.
I can conceive of a situation where a patient who was in significant pain, was unable to take medication any other way.
Hey, James, when we get to a good stopping point, can we take a break? We've been going for about an hour.
Is there somebody in that room with you, Dr. Shiver?
The door just opened up. Nobody's in the room.
Is it within the standard of care to prescribe to an opioid naive patient both fentanyl and an opioid?
Objective form.
You may answer.
I do not think routine practice that you're going to prescribe fentanyl to an opioid naive patient. So I don't think that doing both is any better than doing the fentanyl. I think it is very appropriate to prescribe short-acting opioids to an opioid naive patient.
Not including fentanyl.
Not including fentanyl. It is not my practice to do that. No, I don't think you should do that.
And can you name for me a single textbook, treatise, chapter in a textbook, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaways, anything that's ever been published in the history of the solar system that reads that it's all right to prescribe fentanyl to an opioid naive patient? Name a single one for me, please.
Objective form.
You may answer.
No,
All right. You want to take a break?
sure.
All right. How long would you like?
15 minutes.
Sure. See you in 15 minutes.
Thank you.
Thank you.
Going off the record at 11:06 a.m. We're back on the record at 11:22 a.m.
Dr. Shiver, did you speak with anyone about your deposition over the course of the break?
I've talked to Sharonda Barnes.
About your deposition?
Not about the deposition per se.
Not about the deposition per se. What do you mean by that?
She called me, I said hello. So
You talk about your testimony?
no, she said basically that we normally do breaks of 5 minutes
All right.
instead of
You're-
15. And I said I needed to get a little bit of a break. I went to the bathroom.
If at any time you need a break, you let me know you need a break, all right?
Okay,
And however long you need, we'll take it. All
very
right.
good. Sounds fine.
So we were talking about opioid naive patients. Were you able to come up with any textbook, chapter in a textbook, treatise, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaways, anything in the history of the solar system that reads that it's all right to prescribe an opioid naive patient fentanyl?
Objective form, asked and answered.
So, no, I don't have any treatises or anything like that.
Yes, sir.
It is not my practice to do that. But I could conceive of a possibility where if a patient was unable to take medication, either IV or PO, that you might use a small dose of fentanyl. I've never done it, but I could conceive of it. I mean, that's the best answer I can give you,
And by a small dose, you mean,
for the smallest dose that they have,
which is,
12 micrograms.
yes, sir.
And you monitor them. And if there is a problem with respiratory depression, then you take the patch off and wipe them down.
Yes, sir. And you agree that Shirley Couch was able to take medication PO?
I believe when she first started with the hospice, she was able to take medications PO with some difficulty, but adequately, yes.
Did you ever meet Shirley Couch?
I have seen her on the body cams of the deputies and stuff, but I didn't go to her home or anything like that, no.
You've never examined Shirley Couch?
I don't recall ever having examined Shirley Couch.
Yes, sir. You never took a history from her, true?
I've never directly interviewed her
Yes,
for a history with the hospice. Is that what you're talking about?
Yeah.
Okay.
You been asked the question again, or did you not understand the question?
I did not take a verbal history from her when she was admitted. No,
Yes, sir.
not me personally. No,
Yes, sir. And you've never met her?
I don't recall having ever met her.
Yes, sir. You've never laid eyes on her other than seeing her in the body cam, you said, that the deputy, on the deputy's video, right?
Her name is familiar. If we review the records, you know, of the thing, I believe when you look at Dr. Let me see, Dr. Parks's records.
What are you
I
doing?
can't, I'm trying to review Dr. Parks's records because I'm sure I saw in there that Mrs. Couch was a patient before she was a patient of Dr. Parks, that at some time in the past, she had been a patient of mine and Dr. Rigsby. I don't recall that. I recall her name. I don't recall having ever seen her or examined her, but Dr. Rigsby and I worked together in a practice for a short period of time. And I could have met her in that context. I wouldn't have any idea about what the date or timing was. And I don't recall any personal memory of actually ever met her or interviewed her, but I could have. I don't have those records, so I can't tell you for sure. But I'm sure somewhere in Dr. Parks's record, I read that because I remember that that and myself and Dr. Rigsby.
Objection, move to strike as non-responsive. You agree that it's below the standard of care to prescribe an opioid naive patient 50 micrograms of fentanyl. True?
Object to form.
You may answer.
I would not do that.
Well, one reason you wouldn't do it is because it's below the standard of care to do so. True?
I can conceivable a reason for prescribing 50 micrograms of fentanyl to an opioid naive patient.
Yes, sir. It's
So,
also below the standard of care to do so. True?
You need to let him finish his answer and not cut him off. Dr. Shiver, are you done giving your answer?
no,
Okay, finish your answer, please.
I don't think it would be reasonable for a doctor, myself or any other doctor with my training to prescribe 50 micrograms of fentanyl to an opioid naive patient. So I do not believe that would be in keeping with the standard of care.
Yes, sir. Which makes it below the standard of care to prescribe an opioid naive patient 50 micrograms of fentanyl. True?
Objective form.
You may answer.
Yes,
It's also below the standard of care to prescribe an opioid naive patient 50 micrograms of fentanyl plus an opioid. True?
Objective form.
I don't think you can actually you're saying since you're talking about prescribing the 50 micrograms of fentanyl to an opioid naive patient, and nothing you do after that would ameliorate that. So no, I don't think you should do that either. But I do think that there are short-acting opioids that you can prescribe to an opioid naive patient, and it is frequently and regularly and safely done,
Yes, sir.
but just not in combination. You don't start a 50 microgram fentanyl patch to an opioid naive patient. No.
And it's also below the standard of care to prescribe an opioid naive patient 50 micrograms of fentanyl plus another opioid drug. True?
Objective form.
I thought I just answered that question.
I'd like an answer to that question. It's below the standard of care or it's not below the standard of care?
Same objection.
It's below the standard of care to prescribe 50 microgram fentanyl to an opioid naive patient in combination with any other drug that I know of.
Yes, sir. It would also be below the standard of care to prescribe an opioid naive patient 50 micrograms of fentanyl with or without an additional opioid and with or without an additional benzodiazepine. True?
Same objection.
I just answered that. I think that is below the standard of care.
Yes, sir. I'll show you again what has been previously marked as Exhibit 5. This is your job description for Homestead Hospice. Is
Okay,
that right?
yes,
And I believe when we took the break, we were at qualifications, item 4. This is a document you signed at the bottom, right? On
yes,
January 11, 2013, true?
yes,
And it reads here that you have at least 2 years hospice experience, right?
yes. We've discussed that. Told you my hospice experience was providing hospice care to my own patients. And that was accepted by Homestead Hospice.
All right. Any hospice experience other than providing what you call hospice experience to your own Athens family practice patients?
Not a formal residency or anything like that, no.
Also reads comprehensive knowledge and well-developed skills in medicine, oncology, pharmacology, ID. What does ID stand for?
infectious diseases.
Yes, sir. And what does FEV stand for?
I'm not sure.
You're not sure?
FEV,
That's all right if you don't know. Just let me know you don't know.
I don't know what it is.
Have you taken any continuing medical education in oncology?
As a separate course, no. I've taken plenty of continuing medical education that covered oncology patients, but over time, over the last 40 years,
Any continuing medical education in pharmacology?
same answer. I have taken not a particular course, but I have taken CMA that covered pharmacology, oncology, and medicine and infectious diseases. I'm not sure about the FEV.
Yeah, you refer cancer patients to an oncologist, true?
Yes,
And that's because an oncologist has special training in treating cancer patients, true?
that's correct.
Training that you do not have, true?
Not as much or as detailed or as recent.
Yes, sir. You're not board
Sir,
certified.
No, but I certainly have treated plenty of cancer patients for 40 years.
Yes, sir. You're not board certified in oncology, are you?
No,
You're not board certified in pharmacology.
no,
You're not board certified in infectious diseases.
no.
You never practiced pain management?
I practice pain management every day.
Dealing with your family medicine practice patients?
That's correct.
Anything other than that?
No,
And palliative care, have you practiced palliative care other than in your daily family practice?
that I personally did. I mean, we've referred, I believe there was some palliative care at some time or other with Homestead, but
So this is
not as a, no.
prior to Homestead.
Not other than my regular patients, no.
Yes, sir. You see item 7. Continued education in these areas from the AMDA, American Academy of Hospice and Palliative Medicine meetings, National Hospice Organization, Hospice Association of America, as well as other national organizations. Did you
Right.
ever attend a continuing medical education program by the American Academy of Hospice and Palliative Medicine? If so, when and where?
Yes. It would have been through Homestead. The place, it might have been at the winery northwest of here. I can't remember the place. It was a conference regarding hospice and palliative medicines.
When was that?
While I was working for Homestead, I'm not sure when it was.
Yes, sir. How long did that last?
2 days, I believe. I'm not positive. It might have been 2.5.
And who sponsored that course?
I'm not certain.
What about with NHO, the National Hospice Organization?
I'm not sure who actually sponsored it.
Yes, sir. Have you in addition to that one course that was
No.
sponsored by the American Academy of Hospice and Palliative Medicine, did you take any continuing medical education sponsored by the National Hospice Organization?
First of all, I don't recall for absolute sure that it was the American Academy of Hospice and Palliative Medicine. I know it was a hospice-oriented conference.
Yes, sir. Other than the hospice-oriented conference that was at the winery there
Yes.
north of Athens, any other hospice CME?
No, except for what I get in day-to-day reading. But I don't recall no specific courses, no in-depth courses.
So it was a 2-day course. That was it, right?
Yes.
You see this is the second page of your job description. These are your job responsibilities. Do you see that?
Okay.
These are your job responsibilities, right?
And can you scroll up? That looks,
Sure.
So we
Actually,
can-
there's also a copy that I sent to everyone, including you, in your chat box. You want to open that?
in my chat box.
There's
You
nothing
look-
in the chat
you
box
look-
if you'd like to email it.
What's that?
There's nothing in the chat box.
It says it went to everyone.
Well, I'm letting you know I haven't received it. Would you like to email it?
I will.
I see something. What is the medical director job description? Is that
Yes,
what
so
the,
that's it.
okay.
That's in your chat box.
Yeah, I just saw it.
You want to take a moment to review that before we continue talking about it? You're welcome to
Oh.
do that.
All right. And what page were you referring to?
So the page we're looking at now is page 2,
All right.
where it reads job responsibilities. Do you see that?
Yes.
Item A is administration, adequacy, and appropriateness of service. Do you see that?
Yes.
And that's what you agreed to. 3, provide medical expertise. 5, meet with nurses and other professional staff to discuss clinical and administrative issues and identify areas where policy should be developed.
Yes.
8, ad hoc availability to support other team members with clinical advice and direct assistance with physician communication needs.
Yes.
Those were your responsibilities, true?
Yes. Yes.
And item B, those are your clinical duties, right?
Yes.
And the first one, B1, is monthly and periodic medical director team meetings. Is that right?
Yes.
And you testified earlier that you had those on average more or less twice a month?
2 and occasionally more. Yes.
Yes, sir. And on the next page, 2, develops, amends, recommends, and implements appropriate clinical practices.
Okay,
Also your responsibility.
yes,
And 4, review patient medical eligibility for hospice services in accordance with hospice program policy. Is that right?
yes.
And in order to meet eligibility requirements for Homestead Hospice to be paid by CMS, you know what the CMS is, right?
And Medicare.
Yeah. So the Center for Medicare and Medicaid Services, right?
Okay, yes, okay.
And
is-
you would have to certify that this patient had a diagnosable terminal diagnosis.
Yes,
And what was Shirley Couch's terminal diagnosis?
a cerebrovascular disease with history of multiple strokes and history of ongoing TIAs with decline.
Well, her stroke was suffered 9 years earlier. Isn't that right?
She's had 2 documented strokes,
Yes, sir.
and
Her
she
last stroke was 9 years earlier, right?
actually I think that was the first one. I think there was one since then,
When was
and we'd have to look back at Dr. Parks's records. But I know she'd had ongoing TIAs in the last 6 months, and an especially severe one, I believe in either March or April.
And ongoing TIAs,
Yes,
is that a requirement for someone who suffered a stroke to be Medicare, Medicaid requirements for eligibility for a hospice?
Purely stroke disease.
Sir?
I'm answering. Purely stroke disease, having had a stroke or even had a couple of strokes, would not qualify her to be a hospice patient. And the reason for that, it used to be, but that was discontinued by Medicare some years ago.
Right.
Because it led to people being kept on hospice for too long. So their criteria include that the patient have documented stroke, cerebrovascular disease, and documented ongoing decline. TIAs are considered to be an example of ongoing stroke disease and decline, because TIAs imply that there is continued disease in the arteries of the brain or the arteries leading to the brain, that can and likely will result in a future stroke. And somebody that has already had 1 or 2 strokes, a future stroke is more likely to result in their death. And so decline and ongoing TIAs is what we use to document the decline. That Medicare finds acceptable to predict that the patient, if they continue to have those types of problems, that it's reasonable to expect that they will be dead within the next 6 months. If they somehow recover, they stop having TIAs, they stop having decline, then it is frequent, especially with hospice, because they get closer attention, more nursing care, then they will be discontinued from hospice if we determine that they really are starting to recover instead of continuing to decline.
And give me a site for that, where the TIAs make someone eligible for hospice care under any CMS regulation.
Now, what do they call it?
Form,
Let me answer.
They call it decline.
Right, but I want to cite
Okay,
to what
so
your
TIAs
testimony. Don't let me finish the question. I want to cite to what you testified to, that TIAs and someone who's suffered a stroke previously decline to the extent, please don't interrupt me,
Mhm.
to which causes this patient to qualify for hospice eligibility under any CMS regulation or any other publication. I want a cite to that CMS regulation, those publications, all of those. All right, what are those sites, please?
I don't have a
object to
site.
form, misstates his testimony. You can answer, Dr. Shiver.
I don't have a specific site. It is generally accepted medical knowledge that if you have a patient with stroke disease, ongoing TIAs are basically the continuing decline and are likely to lead to further strokes and death. Other than that, I don't know. The neurologist and stuff will confirm that.
Anything else?
No.
If you look, continuing with item 5, do you see that?
On that same page.
Yes, sir.
Okay.
Can you see this all right?
That's different from what I'm seeing.
Job responsibilities,
Okay.
clinical duties. Thank you. It's item 5 under section B, clinical duties. Do you see that?
B, clinical duties, item 5, acts as medical resource to the IDT.
Yes.
Yes.
You agree that your job responsibilities, including monitoring clinical performance,
Yes.
timely review, oversight, and documentation of patient care by IDT team?
Yes.
And the IDT team is an interdisciplinary team,
Yes.
participates in IDT meetings in order to review the care being provided and to participate in patient care planning.
Yes.
Those are your responsibilities,
Yes.
including for your patient, Shirley Couch, when you cared for her in June of 2017.
Yes.
And you were her physician from the 1st of June until the 27th of June, 2017.
In the hospice. Yes.
Yes, sir. And item 6 offers advice and information to staff on medical interventions to relieve pain and symptoms of disease.
Yes.
That's your responsibility.
Yes.
And daily availability for outpatient and inpatient consults.
Yes.
Available 7 days per week, 24 hours a day.
Yes.
as scheduled for on-call coverage consultation with team members regarding patient's condition.
Yes,
In other words, in Shirley Couch's case, any of the nurses, nurse practitioners, aides could have contacted you 24 hours a day, 7 days per week regarding your patient, Shirley Couch.
yes,
And you were on call to cover those calls
yes,
and advise your colleagues and the care for Shirley Couch.
my colleagues, you're talking about hospice colleagues, hospice care.
Yes, sir. What do
Yes.
you call them? I mean, nurses, colleagues, I mean, nurse practitioners.
Yeah, anybody that was associated with hospice and her care, I would be available to talk to them about her care, but
Yes,
not
sir.
colleagues in general. I wouldn't talk to my partner or something
Right. We're talking about
about
your
a specific patient.
Homestead Hospice colleagues, right?
Yes, that is correct.
Which include everyone listed in Shirley Couch's medical record.
Yes,
And you were contacted at the number in the medical record, which is your Athens family practice number? Is that right?
no, they had my cell phone. They generally call me through my cell phone if they had an issue where I needed to sign paperwork.
Yes, sir. And that would have been the number you shared with us earlier,
Yes,
the Verizon number.
yes.
And you recall taking calls regarding Shirley Couch?
I don't specifically recall that. In reviewing the record, it looks like I took several calls.
Yes, sir. And item 8, inpatient rounds and outpatient visits when indicated and possible. Do you see that?
I see that
That's your responsibility.
when indicated and possible.
Yes, sir. And you never paid an outpatient visit to Shirley Couch, true?
No, I did not.
Because you didn't feel like it was indicated,
That is correct.
including you didn't feel like it was indicated when you prescribed her drugs on June 16th, June 22nd, June 20th, and June 23rd.
That is correct.
You did not feel an outpatient visit was warranted before you prescribed any of those drugs.
No,
Item 9, you see that?
I'm reading it right now.
Yes, sir.
Well, this is all in response to nursing home.
Yes, sir. That's not applicable to this case, is it?
No,
C, admission and certification. Do you see that? That's also your responsibility.
yes,
Your responsibility is to confirm the diagnosis and prognosis for each newly admitted patient.
yes,
And that's what you did for Shirley Couch.
yes,
And you've already shared with me today that her prognosis was that she would live for 6 months or less if her disease process progressed normally. Is that right?
yes,
And that's because in addition to her previous strokes, she was having what are called TIAs.
yes, in addition to other things. Weight loss, especially the fact that she was having a decline in her functional abilities, where around the first of the year, I believe she was able to actually ambulate with a cane relatively safely, although she had had falls. By the time June went around, she was essentially bedbound and total care. So that constitutes a very significant decline in her functional abilities and indicates that her disease seems to be progressing.
Yes, sir. And you prepared what's called a CTI, is that right?
Yes, a certificate of terminal illness.
Yes, sir. And I'll show you what's been previously marked as, I think this is item 6, Madam Court Reporter.
That's correct.
Thank you. Item 6, that's your signature at the bottom,
Yes,
and that's dated,
13 June.
thank you, June 13, 2017. Yes,
Yes,
that's for Shirley Couch.
yes,
And you're attached Homestead Hospice and Palliative Care. This is your narrative, is that right?
that is correct.
And it reads, Mrs. Couch is an 81-year-old female who suffered a severe cerebral hemorrhage resulting in flaccid hemiplegia. Please, her left dominant side. Is that that's what you wrote?
It should have been regarding her left dominant side.
Yes, sir. And you agree that that alone would not qualify someone for hospice care? True?
That's true.
It goes on to read, she is having continued problems with TIAs. Is that right?
That is correct.
And it's your testimony that the continued problems with TIAs does make her qualified for hospice care because the continued TIAs indicate in your view that she will not live over 6 months.
Object to form.
That in combination, there are several factors and stuff, the comorbid conditions, the fact that she's unable to take anticoagulants when she has a history of irregular heartbeat and repeated DVT. And the functional decline over the last 6 months, these all make her at very high risk for another stroke that would be life-threatening.
Yes, sir. It goes on to read she has comorbid conditions of hypertension, that's high blood pressure, right?
Yes, yes,
Carotid artery disease and a previous clotting disorder.
yes,
And that previous clotting disorder, you're talking about a DVT is a deep vein thrombosis, true?
yes.
And she had that in the lower extremity, is that right, or leg?
She, looking back over Dr. Park's record and the hospital records, she had documented, well, I'm not sure, but it was more than three or four times where she had repeated DVT in the left lower extremity, and was, I guess it was determined to be chronic DVT, where it was ongoing.
DVT is not a terminal diagnosis, true?
It would not be by itself
Yes, sir.
a thing for Medicare diagnosis, although not being able to treat chronic DVT and chronic irregular heartbeat will progressively increase her likelihood of stroke just from that diagnosis, not including her already significant history of cerebral hemorrhage
And you're,
and or the other stroke that she had.
and is that because she was not a candidate for a surgical procedure to correct it?
No, that's because she was not a candidate to continue taking anticoagulants.
Yes, sir. And tell me, that's based on what?
I believe the decision was made, I think gradually, but I'm estimating, I believe it was not December, but January of 2017, she had fall and hemorrhage that caused her doctors to determine that she was at more risk from the anticoagulants than she was from the DVT or irregular heartbeat. So they stopped the medicine.
You agree a fall and a hemorrhage doesn't qualify someone for hospice care, true?
By itself, no.
I'm going to show you. Go ahead.
It's basically a contributor. It's a contributor to the overall picture of the patient being at increased risk for death.
Yes, sir. Did you ever review Shirley Couch's cardio clearance?
Cardio clearance.
Yes, sir.
I'm unfamiliar with what you're talking about.
All right. I'm going to show you what's been previously marked as Exhibit 7.
Okay.
Is that right, Madam Court Reporter 7? Have you ever seen this document before? This is also in your chat box if you want to review it.
Okay. That's
See that?
oh,
Have
for
you
a
ever
minute.
seen that before today?
Is this in the I don't recall having seen this. It's if it was during one of her hospital stays. I might have seen it in passing. Let me think.
Yes, sir.
Let's see.
You agree it's important to take a thorough history before committing someone to hospice care?
Sure.
Have you, this is a final report, is that right? See where it reads final report here?
I see final report, but I am okay. Let me see.
Athens Cardiology. Are you familiar with the Athens Cardiology Group?
Yes.
And this is dated 4/4/2017. That was your birthday that year, right?
Yeah, it was.
And it reads down here, do you see where it reads assessment plan?
Yeah, I'm reading it now. Okay, so what is your question?
You read that she was cleared for surgery, right?
I read that
Form.
You may answer.
I read that I have recommended additional ischemic evaluation with nuclear stress test and echocardiogram to better risk stratify her. If these are unremarkable or low risk, then she can proceed as planned with surgery with acceptable cardiovascular risk. And he would consider starting Xarelto or Eliquis for DVT prophylaxis. We'll discuss it with her surgeon.
Would you
I-
read my question, please?
I
Madam?
don't think this is clearance for surgery. This is the initial, this a minute. This is
What did you say?
just a minute.
Just a
That's-
minute. Are you still answering the question?
Yes,
The question was not for you to read the assessment plan aloud. Can you hear my questions all right?
okay. Can the court reporter repeat his question?
Do you mind repeating the question, please, Madam Court Reporter?
Question, you read that she was cleared for surgery, right?
Objective form, asked and answered. You can answer again, Dr. Shiver.
No, she's not cleared for surgery.
Do you see where it reads testing normal, okay, underline to proceed, Sherry Mull, LPN
Oh,
at
okay.
Athens Cardio? You see
okay.
that?
Oh, I do now. Yeah. I was just reading. I wasn't sure what that was.
The thing about it
Sherry
is,
Mull.
that's something
Ellen.
you ought to have read before. If you're taking a history of your patient, including Shirley Couch, this is something you needed to read, is
I
it not?
Objective
I
form,
disagree.
All right, so this is, you agree a thorough medical history doesn't include an assessment plan by Shirley Couch's cardiologist, true?
same objection.
I don't agree that a thorough history includes a complete review of and detailed reading of every piece of paper in her record. I don't agree with that.
And you agree that contradicts what you wrote in her medical record, right? That she wasn't cleared?
No, I don't.
I'll show you what's been marked as Exhibit 8. And the first thing I want to know is, have you ever seen this document before?
And who's writing this?
Have you ever seen do you understand the question, Dr. Shiver?
I have never seen this before. No.
Very well. This is a letter from Athens Neurological Associates. Are you familiar with Athens Neurological Associates?
Yes,
Yeah, and you understand that Athens Neurological Associates has board certified physicians in that practice.
yes,
They're board certified in neurology, right?
yes.
You're not board certified in neurology, are you, Dr. Shiver?
No, I'm not.
All right. And this reads, this letter is written per HIPAA protocol. This letter is to state that I've seen and examined the patient at Piedmont Athens Regional for diagnosis of TIA. Do you see that?
Yes,
And what is a TIA?
transient ischemic attack.
And what is that?
It is a transient ischemic attack. It's symptoms that are stroke-like, that can lead to stroke, but are usually temporary and resolved within 24 hours.
Temporarily and resolved and much
Usually,
milder than a cerebral than a stroke, right?
they are considered warning signs of stroke. It is not a stroke,
Right.
but there are, when you're first viewing a TIA, you can't tell the difference. It could become a stroke, but it might resolve.
You see where it reads, she also currently has a UTI that may be contributing to her symptoms. No evidence of new CVAs since admission. You see that?
Yes,
I've adjusted her medications and she will follow up in clinic. It is my opinion that this patient would be moderate risk for surgery from a neurologic standpoint, but I do not think her risk is impacted significantly by this hospital stay. You see that?
I see that.
She would benefit from possible pain relief and improved mobility that surgery could provide.
Yes,
So she was also cleared for surgery by Athens Neurological Associates. True?
okay.
And you never saw that before today?
No, I've not seen that before today.
All right. I'll show you what's been previously marked as Exhibit 9 to your deposition. Is that 9, Madam Court Reporter?
That's correct.
Thank you. Have you ever seen that document before?
I'm reading it now. I might have seen this in the last few weeks.
You hired Renee Bonner.
No,
You participated in her hiring.
no,
Right. Were you aware before today that Renee Bonner was arrested in Georgia 36 times?
I had heard about it in reference to, or this GBI investigation within the last couple of weeks.
All right. You didn't know about it before the last couple of weeks, right?
No, no,
And you didn't know about it before while you were employed at Homestead Hospice.
No,
Objection, relevancy calls for speculation.
Goes on to read, between 1982 and 2000, Bonner was arrested for deposit account bad checks 32 times. Do you see that?
Objection, relevancy calls for speculation.
You may answer.
I see it.
Were you aware of that before
No.
2 weeks ago?
Same objection.
What was your answer?
No,
Have you employed anyone at Athens Family Medicine that had been arrested 36 times?
no,
Would you employ someone who'd been arrested 36 times?
I would have to look very hard at it.
Yes, sir.
One, I'd like to see whether or not, whether they were convicted of anything. But yeah, that would be something that I would like to investigate thoroughly.
Yes, sir. In 1985, Bonner was arrested for theft by taking as well as criminal trespass and terroristic threats. Were you aware of that before 2 weeks ago?
Objection, relevancy calls for speculation.
You may answer.
No,
1994, Bonner was arrested for financial transaction card fraud. Were you aware of that before 2 weeks ago?
Objection, relevancy calls for speculation.
no,
And 2 weeks ago was May 2021. Is that right?
roughly.
You were not aware of Renee Bonner's criminal history before May 2021.
No,
Objection, relevancy calls for speculation.
You worked with her at Homestead Hospice for 6 years.
I'm not sure how many years that we worked together.
Well, 2013 to 19, 13, 14, 15, 16, 17, 18. I think you stopped the first of 19, so that would have been 6. Is that right?
I'm pretty sure she was working that whole time, but I'm not sure.
Yes, sir. Did you work with her when she was there?
I'd say hello to her on the way to IDT.
Yes, sir. And do you recognize her handwriting?
No, I wouldn't notice it.
Now, in order to prescribe a drug, you have to know what the drug is.
Is that a question?
Yes. You gonna
Yes.
have it read back for you?
No, I don't prescribe drugs that I don't know.
So you agree that in order to prescribe a drug, you have to know what the drug is.
Yes,
Yes.
I agree.
You have to know what the drug does.
I agree.
You have to know the adverse effects of that drug.
Within reason, yes. There are lots of adverse effects. Knowing each and every one of them wouldn't necessarily be in keeping with prescribing it.
You have to know the interactions of the drugs you're prescribing with the other drugs that the patient is also being prescribed.
Yes,
And before you prescribe a drug, you have to evaluate a patient.
yes,
To ensure that that drug is the right drug for that patient.
I think you need to review what's going on with the patient, have a good idea about what's the patient's condition is, and what other drugs she's taking, he or she.
Yes, sir. And you have to have a reason for those medications for that patient.
Yes,
And are you familiar with Shands?
Shands Teaching Hospital.
Yes, sir.
Yes,
What is Shands Teaching Hospital?
University of Florida.
Yes, sir.
Yes.
Are you familiar with Shan's drug and therapy bulletin?
No,
I'll show you what's been previously marked as Exhibit 10 to your deposition. Have you ever seen this document before?
no,
I'm going to send you a copy. In chat for you to read. You agree that although opioids are often titrated to the effective dose to avoid dose-dependent adverse effects, the appropriate starting doses are the use of potent and or long-acting dosage forms for chronic pain depend on whether patients are opioid tolerant or opioid naive. True?
that is true.
And that tolerance implies less than the expected response to an opioid, right?
That is true.
Tolerance can be a genetic predisposition or acquired.
That is true.
At this point, there is no way to predict genetic traits that would require higher starting doses. You agree with that?
That is true.
Acquired tolerance is the primary focus of this review. As patients take opioids, they will require higher doses to obtain the desired pain relief. You agree with that?
Yes,
And you agree that, for example, transdermal fentanyl patches should only be used in patients who are already receiving opioid therapy and who have demonstrated tolerance and who are not opioid naive. You agree?
I think there is a recommendation that I find reasonable.
You agree with that?
Sample transdermal.
Objective form.
I don't know that I agree to that. No,
All right. And cite for me any treatise, text, chapter in a text, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaways, anything published in the history of the universe that you can refer me to that gives you cause to disagree with that.
Objective form.
personal experience over the last 40 years has shown that in certain instances, and then using a fentanyl patch and somebody who hasn't demonstrated tolerance might be useful.
So thank you. Objection, move to strike is non-responsive. My question, Dr. Shiver, is this. Cite for me any treatise, textbook, chapter in a textbook, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaways, anything published in the history of the solar system that would cause you to disagree with what's in this Shan's bulletin.
Objective form, asked and answered.
You may answer.
No,
All right. It goes on to read, giving potent, long-acting opioids like a fentanyl patch to opioid-naive patients has resulted in deaths. You agree with that?
yes,
Thus, fentanyl patches should not as in all caps, be used for acute pain. You agree with that?
I agree.
I'll show you what's been previously marked as Exhibit 11 to your deposition. Have you ever seen this photograph before?
No,
Are you familiar with the Drug Enforcement Agency?
I am.
The DE, also referred to as the DEA.
Yes,
The Drug Enforcement Agency is a federal agency.
yes,
And do you agree that this photograph just depicts the amount of fentanyl that can kill an opioid naive patient relative to a 2012 Lincoln Head penny?
Object to form, calls for speculation.
You may answer.
I don't know. I can't tell what that is. I'm not sure what, if that's supposed to be fentanyl, if it is. So I'm assuming that the DEA is giving a visual representation of the amount of fentanyl that would take, but the concentration matters. So I'm not sure how that applies to the fentanyl that we prescribe.
Objection, move to strike is non-responsive. Madam Court Reporter, do you mind reading back my question, please, ma'am?
Question, and do you agree that this photograph depicts the amount of fentanyl that can kill an opioid naive patient relative to a 2012 Lincoln Head penny?
Same objection, and now add on asked and answered.
I don't know.
All right.
Let us know when you get to a good stopping point for a break.
Sure. You guys wanted, you mean for lunch?
Yeah, I mean, assuming you have much more to cover.
Yeah, we're gonna be, yeah, now's fine. Do you want to start back at 1:30?
I don't think we need that long. Dr. Shiver, are you good with about a half an hour to grab something to eat?
Yeah, that'll be fine.
How
Okay,
much time?
a half an hour.
One
No,
o'clock.
we'll need an hour for lunch break, but you
I
want
don't
to
think
take,
he's saying he needs a full lunch break. Do you need a full lunch break?
yes.
Okay. All right, well, we'll see everyone back at 1:30 then.
All right.
All right.
Going off the record at 12:35 p.m. We're back on the record at 1:32 p.m.
Mr. Shiver, I'll show you what's been previously marked as Exhibit 13. 12. Thank you, Madam Court Reporter. Have you ever seen that document before?
No,
You know what carfentanil is?
no.
This is a drug enforcement agency, again, a federal agency's illustration about the difference in a lethal dose of heroin and a lethal dose of fentanyl. Do you see that?
I see it.
You see heroin on the left, fentanyl on the right.
Yes,
Would you agree on based on your education, experience, and training, that that is an accurate lethal dose of heroin relative to an accurate lethal dose of fentanyl?
Object to form.
You may answer.
I couldn't determine that unless I knew what the actual concentrations, purity of the medicines are.
And what's the concentration of fentanyl you prescribe?
50 micrograms per hour.
What are you looking at?
50 micrograms per hour.
50 micrograms per what?
Per hour.
But I thought you were talking about the amount of the drug and that.
I'm not sure what the actual concentration is. We go by the rate of absorption.
Now, you prescribed a number of drugs for Shirley Couch. Yes.
Yes.
I'm going to show you what's been marked as Exhibit 13, your deposition. Actually, we'll make this Exhibit 14. See that document?
I do.
And this is a Homestead Hospice physician's order. It's your physician's order for Shirley Couch for June 2nd, 2017.
Okay.
Yes?
That's correct. That's correct.
And that's your signature at the bottom.
That's also correct.
And it reads on the left, it's got a date. Is that right?
Yes.
And the third drug down, it reads 6/2/2017. That's June 2nd, 2017, when Shirley Couch was your patient.
Yes.
Yes. And you prescribe haloperidol.
Yes.
Haloperidol is also referred to as Haldol.
Yes.
And you prescribed 0.5 milligrams.
Yes.
Take 1 tablet per oral, sublingual, as needed every 4 hours.
Yes.
And that as needed for nausea and vomiting and agitation.
That's correct.
Total of 6 tablets.
Yes.
And Haldol is a class of drug called an antipsychotic. Yes?
It is included in that class of drugs. Yes. It's also got multiple uses.
Yes, sir. And you did not evaluate Shirley Couch before you prescribed this antipsychotic drug on June 2nd, 2017.
I would disagree with that.
You never saw her.
I never personally laid eyes on her, but we evaluated her medical record, her past history as related by Dr. Parks.
All right. You reviewed her record.
Yes.
Did you review Dr. Parks' deposition?
Yes, I did in the past.
All right, and you saw then where he said Shirley Couch was indeed an opioid naive patient.
Objection.
Disagree.
Back to form.
You read that?
I disagree. I didn't read that. He said she was not an opioid naive patient.
So your testimony is that Dr. Park classified Shirley Couch as a non-opioid naive patient.
Yes, that's what I understood.
And you consider Shirley Couch a non-opioid naive patient.
Yes, and she has been for several years.
On June 2nd, 2017.
She has been for several years and was not an opioid naive on June 2nd.
All right. And that's based on what?
Review of her records.
And what in your review of the records indicates she's not an opioid naive patient?
One, she's been taking an opioid tramadol for relatively regularly for a while. She'd also been given Percocet intermittently throughout her record. I believe she also was administered it in the hospital, but I can't actually recall that particular visit.
So it's your testimony that Shirley Couch was taking tramadol regularly and Percocet regularly. Is that right?
Object to form.
Join.
I said that she had been regularly prescribed tramadol and getting refills for that. And she had also been prescribed and for Percocet at least twice that I read in her records.
Twice in how many years?
I believe the record started 2014. I'm not positive of that.
Uh-huh. Tell me, cite for me, please, any treatise, textbook, chapter in a textbook, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaways, anything published in the history of the solar system that would suggest that Shirley Couch, the amount of tramadol that she'd taken in her medical record, Dr. Park's record that you're referring to, and the amount of Percocet that she'd taken would cause her not to be an opioid naive patient.
Object to form.
An opioid naive patient is a patient who has never taken an opiate and subject to certain unexpected respiratory depression, usually within the first few days, 2 to 3 days of receiving something like that. But I can't cite a particular source.
All right. Now I'd like for you to cite for me any treatise, textbook, chapter in a textbook, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaway, anything published in the history of the solar system or what you just testified under oath to, that an opioid naive patient has, quote, never taken opioid, close quote.
Object to form.
Anything in the
Boy.
history of the solar system.
I don't have any references, but that is the definition of naive.
The deposition of opioid naive is someone who's never taken an opioid. True?
Object to
Yes, or-
form.
Join.
Or
I
is
hear your answer over the objections. Was it that?
or is newly exposed to it.
So
the
if someone
react-
had an opioid 20 years ago, that's not an opioid naive patient?
No, I don't think they meet the criteria for opioid naive. But even with that, I would be basically starting at lower doses of milder medicines like tramadol, and
Yes, sir.
gradually
someone-
working my way up.
If someone had had an opioid 20 years ago, that makes it okay to go ahead and give them a 50 microgram fentanyl patch. True?
Object to form.
Join.
You may answer.
It all depends on the setting, where they're, what type of problems they're having, whether or not they're able to take medicines by mouth or medicines by vein. But I don't use and don't think it is appropriate to use fentanyl patches in a acute pain situation, period.
Sir, my question had, did you hear acute pain in that question?
No, that's just my my response.
Sir, would you read back my question, please, Madam Court Reporter?
Sorry, was I muted? Did you hear it?
I couldn't hear anything.
Sorry. Um, Question, if someone had had an opioid 20 years ago, does that makes it okay to go ahead and give them a 50 microgram fentanyl patch? True?
Object to form.
Join.
You may answer.
I don't consider them an opioid naive patient, but I would not give them a 50 milligram patch.
And that's because they haven't had enough opioids recently to affect their reaction to an opioid that you administer now.
Objection to the extent it calls for an incomplete hypothetical.
Honestly, I probably would ask a pharmacist if that was if I saw the need for something like that, although I can't conceive of the need right now why I would give a patient a 50 microgram fentanyl patch as a first drug in 20 years.
Yes, sir. And when you were the medical director at Homestead Hospice and on call 24/7, the captain of the ship, did you ever call a pharmacist to ask a pharmacist advice about drugs you were prescribing for your Homestead Hospice patients?
Yes.
Okay. And how often did you do that?
We consult with pharmacy every few IDT meetings. Every few is an estimate. 3 or 4 IDT meetings, something would come up. Or if I need some type of conversion from one type of drug to another, we would consult the pharmacist.
And did you consult a pharmacist about Shirley Couch?
I don't recall doing that.
And the reason you would consult a pharmacist about what drugs to prescribe is because you weren't comfortable with your own knowledge.
Object to form.
You
Join.
may answer.
If or if it was a special situation to where I'm converting to something that I don't have any experience with. So we would double check with the pharmacist to make sure that we had the conversion right. Or sampling the dosage and stuff.
So back to Exhibit 14.
Yes,
This is still your physician order for Shirley Couch dated June 2nd, 2017.
sure.
And you see item 562/2017 morphine,
Yes,
20 milligrams per milliliter. You prescribe that?
yes.
A 30 milliliter bottle?
30 milliliter total disposition. I believe it comes in 15 cc bottles, and there probably would have been 2 of them.
All right. So you think that was 2 15 milliliter bottles as opposed to 1 30 milliliter bottle?
I believe so. It depends on what was available at the pharmacy.
Yes, sir. Doesn't make a difference in this case, does it?
I don't see how it does, no.
All right. So morphine, what is it? 20 milligrams per milliliter. What is that? Sublingual or what is that?
It
After-
should PO or sublingual every 2 hours as needed for pain or shortness of breath.
I'm still on the first. Is this your handwriting or Nurse
No,
Pippin's?
It's not mine.
Nurse Pippin? If you
That's
know.
Nurse Pippin.
All right.
Okay, it's morphine 20 milligrams per cc, per milliliter solution. Take 5 to 20 milligrams, 0.25 cc or milliliters to 1 cc or milliliter. It
Yeah,
can be given
milliliters
either.
the same as a cc, right?
That's correct.
Sir?
PO or sublingual every 2 hours as needed if the patient's in pain or having shortness of breath.
Yes, sir. And that's what you prescribed for Shirley Couch in addition to the Haldol.
Yes,
And when you prescribed that, you had not seen Shirley Couch.
I had evaluated her chart.
Yes, sir. But you had not seen her, right?
I had not visually laid eyes on her, no.
And you hadn't spoken to a nurse that had seen her either.
I don't know that to be true.
Now back to Exhibit 14. You see immediately beneath morphine, also June 2nd, 2017, your physician order for Shirley Couch, lorazepam.
Yes,
And what is lorazepam?
it's an anti-anxiety medicine,
Yes, sir. What class of drug is that?
benzodiazepine.
Yes, sir. And how's a benzodiazepine different from an opioid?
They affect different parts of the brain.
Yes, sir. And it reads lorazepam 0.5 milligram tablets, take 1 tab, PO, that's by mouth, SL, that's sublingual every 4 hours, PRN or as needed for anxiety. Is that right?
That's correct.
And you prescribe 6 of those as well?
Yes,
And before prescribing lorazepam, you hadn't seen Shirley Couch either, right?
I had evaluated her chart and the report from the nurse.
Okay. You evaluated her medical records, right?
Yes,
And the report from the nurse, what report from the nurse?
whatever was available at the time.
What was that?
I have no idea what was available at the time.
Okay. And you wouldn't be able to tell that today?
No, I certainly don't have a personal recollection of it,
Yes, sir.
but when we're giving orders as a routine, We review what the nurses evaluated of the patient and reviewed the history of the chart from the referring physician and make a decision about how to treat the patient.
Yes, sir. So that was just Dr. Park's record, right?
Yeah, that would be only Dr. Park's record.
Yes, sir. And I'll show you what's been previously marked as Exhibit 15 to your deposition. And this is your physician order for Shirley Couch for June 16, 2017 for Norco. Is that right?
That's correct.
That's your signature at the bottom.
Yes.
And Norco is also known as what?
Hydrocodone. It's mixed with Tylenol.
Yes, sir. And what classification of drug is Norco or hydrocodone?
It's an opiate,
Yes, sir.
a
And
mixed opiate.
yes, sir. It's
Sorry.
mixed with,
Tylenol.
and the strength is 7.5 over 325 milligrams.
That's correct.
PO, that's by mouth. Every 4 to 6 hours is needed for pain.
That's correct.
Dispense 6 tablets.
That's correct.
All right. Dr. Shiver, I'm going to have to take a short break. We've got a brief hearing with another judge. I anticipate I'll be 15, 20 minutes. So I'm going to need to take a break till probably about a quarter after. All right.
Okay.
I'll see you then.
Going off the record at 1:55 p.m. We're back on the record at 2:31 p.m.
Exhibit 15, Dr. Shiver, this is your RX for a hydrocodone for June 16, 2017.
Yes.
And what I'd like to know is what happened between June 2nd and June 16th, 2017 that caused you to prescribe more opioid medications for Shirley Couch?
All right.
Did you see Shirley Couch between June 2nd and June 16th?
No, I received nursing reports.
All right. And what in those reports caused you to prescribe more opioids for Shirley Couch on June 16, 2017?
Let me look and find the
All right.
issues. Okay, that's gonna be a skill nursing visit from Rachel McKnight,
Okay, on what day?
June 15th.
All right. And what about that skilled nursing visit?
Family and patient reports Mrs. Couch has experienced significant decline in function and cognitive ability last 3 months. She presents with increased pain on her left side. Oh, well, that's past. Let me find the exact wording.
What page of her skilled nursing visit are you referring to?
Right now, I'm looking at 16 of 16.
All right, the last page,
Yeah, I think so.
narrative notes.
Yes. Having chest pain and dyspnea that worsens. And her exertion is basically in the bed. So she's having chest pain with minimal exertion. And another part of her note. She's describing her pain as constant, aching, burning, and shooting. Increased with movements and having a severe effect on her functioning. And this is in the face of her taking her tramadol to inadequate effect. So I am increasing the dosing, basically the medication, the strength of the medication to hydrocodone, in an attempt to give her better relief of her pain so that she can function on a better basis, on a day-to-day basis, and
Anything else?
and not suffer. Yes. Let's see. I believe basically it's going to be that she is continuing to have significant pain, and it's not responding to the tramadol. This is an attempt to give her better pain relief, so we're prescribing the Norco.
Mhm. When you prescribed the hydrocodone on June 16th, 2017, how much of the Haldol had she already been administered?
Haldol? I
Yeah.
don't know that she had ever actually been administered Haldol.
All right. How much of the morphines had she already been administered?
I don't believe it was dispensed until later in her course.
All right. How much of the lorazepam had she already been administered?
I need to check something on that. Let's see. I don't believe the lorazepam was dispensed until the 23rd or the 22nd, 23rd, looks like. So she hadn't had any of it.
All right. So hydrocodone and her stay between the 2nd and the 26th of June 2017 with Homestead Hospice, the first opioid that she was administered, prescribed by you, was hydrocodone on June 16th, 2017.
No, I don't believe that's true. I think she'd been on tramadol throughout that entire time.
All right. And you prescribed the tramadol as well?
I'm not sure if it was me or if she had it in a prescription from Dr. Parks, but I'm not sure that it makes a difference who prescribed it. She was using it and it wasn't working, at least not adequately.
And that's why you prescribed the hydrocodone on June 16, 2017.
Yes.
I'll show you what's been marked, previously marked as Exhibit 16.
16.
Is that right, Madam Court Reporter?
That's correct.
That's Couch versus Homestead. Oh. Oh, okay.
Show you what's been previously marked as Exhibit 16 to your deposition. This is another position order.
There's nothing on the screen.
Yeah. Can you see that, Dr. Shiver?
Yes.
And this is your physician's order for Shirley Couch 4 days later for June 20th, 2017.
Correct.
And you didn't see Shirley Couch between June 16th and June 20th, true?
I reviewed her records and the nursing reports and possibly received a nursing call during that period of time. So I did not visibly go into the home and see Shirley Couch.
Yes, sir. And on June 20th, 2017, you prescribed hydrocodone again,
Yes,
and it's the same dosage. This time, instead of 6 tablets, it was 30 tablets.
that's correct.
Tell me why you, 4 days later, prescribed Shirley Couch 30 more tablets of hydrocodone.
I'm reviewing a record, so hold on for a minute.
Dr. Shiver, if you're talking, I can't hear you.
Dr. Shiver, we still can't hear you. No, still can't hear you.
Shall I go off the record?
Yes, please.
That's fine.
All right, going off the record at 2:47 p.m. Back on the record at 2:47 p.m.
Can you hear me well, or do I need to? I had to swap to a different microphone. All right.
I can hear you fine.
Okay. That's going to be related to a note on 6/19/2017 from LPN Christy Fowler. It's a 4-page note.
Uh-huh.
She visited the patient. She was much better on the Lortab. It seemed to be giving her better relief, but she was out of the medication. So we refilled the prescription and dispensed 30 tabs.
All right. Any other reason?
Not that I can think of, or that is noted in the note.
Shiver, I'll show you what's been previously marked as Exhibit 17 to your deposition.
Okay.
You see that all right?
Yes, it's a handwritten prescription dated 6/23/17.
That's the wrong note.
Or one other.
Right. Exhibit 17 is a physician's order. This is dated June 22nd, 2017. Do you see that? That's your signature at the bottom.
Yes, I see that.
And this is for fentanyl,
Yes,
50 micrograms per hour.
yes,
And route is TD, that's transdermal.
yes,
Q 72 hours for pain.
yes,
Dispense 5 patches.
correct.
And Q 72 hours means what?
To place a patch on, clean skin, take it off 72 hours later and replace with another patch.
So,
On
and
clean skin. Probably you want to change the site as well.
now, in those 2 days between the 20th and the 22nd, you did not see Shirley Couch, right?
No, I did not see her physically. I reviewed patient notes, and nursing notes.
What I'd like to know is why on the 22nd, you added fentanyl
Okay,
to the hydrocodone for
all
Shirley
right.
Couch.
I'm reviewing the note now.
Sir?
I'm reviewing the note now.
All right.
Okay, this is going to be skilled nursing note. Rachel McKnight,
All right.
and the visit, I believe, was on 6/22.
Uh-huh.
This was her comprehensive visit.
Mhm.
The narrative note. States that she is having decline.
And what page of that note?
15 or 16. I'm skipping to the narrative. I'll go back up to the rest of the note a little bit.
Which note are you talking about?
All right. This is visit note 6/22/2017, RN Rachel McKnight.
All right.
am on the bottom of page 15 of 16.
Yeah.
Okay. 3 lines up. In the past 2 weeks, patient status has changed to bedbound.
What?
She reports experiencing increased shortness of breath with slight exertion, and her only exertion is in the bed, such as a brief change or repositioning in the bed, and chest pain and sharp chest pain, and increased dizziness that worsens as she does this. And skipping to the next page, when she stops exerting herself in bed, the chest pain dissipates. She's also reporting increasing severity with dysphagia.
Well, you left out, it reads relieved with rest. Isn't that right?
That's what I just said. It
Right.
dissipates with rest, or relieves with rest.
Dissipates?
Dissipates,
Dissipates.
goes away.
Yeah, I know what dissipates mean. Thank you, though. What else?
She reports increasing severity with dysphagia, meaning that the she's choking with food, and that they're having increased difficulty getting the medicines that she needs for pain relief down.
Dysphagia means she's choking with food.
It means she's choking, period. Yes.
Difficulty swallowing, you mean?
That is part of it. Yes.
All right.
She's advanced to the point to where they're going to change her diet because the increased difficulty with swallowing, which means she's not going to be able to get her meds as down as reliably, and it could, depending on that, is not a reliability of getting her medication.
Right. Did you feel like you might ought to see Shirley Couch before you prescribed 50 micrograms of fentanyl?
No, I didn't.
I'll show you what's been previously marked as Exhibit 18. Did you speak to these nurses over the phone?
Um,
Can you hear me?
yeah, I'm looking. I mean, I don't know from memory, so I'm going to have to check the record. Yes.
Yes, what?
To your question. I spoke to him.
Okay. When did you speak? Who did you speak to and when?
Rachel McKnight.
What day and time?
That day, 6:22. Time is 18:18.
For how long?
No idea.
That would be in your phone records though. True.
I would assume so.
Any recollection of that call?
No, not direct.
Any recollection of any calls with any providers for Shirley Couch from June 16th through June 26th, 2017?
I don't have a direct recollection of actually talking to her with the name Shirley Couch in my head and prescribing a medicine, depending upon the records to support this.
Show it has been previously marked as Exhibit 18 to your deposition.
Yes,
This is another physician's order for Shirley Couch by you the following day. Is that right?
yeah, that looks like when it was logged. Yes,
And that's your signature at the bottom.
yes,
And on the 23rd, you prescribed another 30 milliliters of morphine. Is that right?
it's actually the same 30 millimeters morphine.
What do you mean the same 30 millimeters?
The first was never dispensed.
And what makes you say the first was never dispensed?
Because there's no record of him being dispensed. The original order from the second was in response to evaluation of her history, the records, and the nursing report. It says that she's having issues with the decline in function of her cerebral vascular disease,
Uh-huh.
and is having significant pain, both musculoskeletal pain from osteoarthritis in her knees, and neuropathic pain, and likely orthopedic pain as a result of her stroke. So when we admit patients to the hospice care, we like to be able to respond to the patient's needs on weekends or in the middle of the night and stuff. So it's easier to have medications available, or at least orders for medications available. They might not ever be used, and frequently might not be. So looking at the orders in the review of her chart, I didn't see where the morphine was dispensed until the 23rd. And I think that's borne out by the CVS documentation that the only morphine ever dispensed was on 6/23, and the quantity dispensed was 30 cc's.
So your testimony is that Shirley Couch was only dispensed one 30 milliliter bottle of morphine when she was in Homestead Hospice care in June 2017.
She,
Is that
according
your
to
testimony, doctor? Is that your testimony?
my testimony is that reviewing the records, that she only received a total dose or total dispensing of 30 cc's.
30 milliliters.
Yeah, 30 milliliters. And that was on the 23rd. And I am relatively sure that this was dispensed in 2 bottles of 15 cc's each. And only one of those bottles was ever opened.
And you base that on what?
That's going to be according to the investigators' reports.
What investigators' reports?
I believe it's going to be the deputies that initially responded. They had body cam videos, and I have reviewed those. There
Show me
was,
tell me what report you're talking about.
it's actual videos. There is, let me see. There is a Madison County Sheriff Office report from Joseph Adam McGuffin.
Anything else?
It said, saw a bottle of morphine on the dresser and it looked as if it was empty. But if you look at the tape, then you can see that the bottle's empty, and that the second bottle is unopened. And that's all I can remember at the moment. There might be other documentation of that. I don't know.
You see Exhibit 18?
This is a written order 6/23/17.
Right. You prescribed 20 milligrams per milliliter, 0.25 to 1 milliliter per oral sublingual Q2 hours PRN dispensed 30 milliliters. True?
Yes, that's correct.
Pain and shortness of breath.
That's correct.
You also prescribed Ativan, 0.5 milligrams PO or oral, Q4 hours PRN anxiety. Dispensed 45 tabs.
Yes,
And Ativan is what class of drug?
benzodiazepine,
And morphine is what class of drug?
opiate.
And your starting dose for Shirley Couch of fentanyl was 50 micrograms, true?
That's true.
Now, Shirley Couch did not have cancer, true?
Not that I know of.
She didn't have any metastatic bone lesions, true?
Not that I know of.
Didn't have any brain cancer.
Not that I know of.
She didn't have what you would describe as intractable pain. True.
I disagree with that.
Okay, you describe what Shirley Couch had as intractable pain.
Yeah.
All right. Give me a cite to any treatise, textbook, chapter to textbook, peer-reviewed article, non-peer-reviewed article, grand round, throwaways, anything in the history of the solar system that describes Shirley Couch's pain as intractable pain.
Object to form.
Give me an answer.
All right. No, I don't have a readily available citing, but I can tell you from reviewing her record that she is routinely having level 5 or thereabout pain on a daily basis, that she is having much worse pain with any type of activity, and that she is screaming with pain whenever somebody touches her skin. We've given her lesser opiates, including tramadol and now Norco. The Norco helped initially, but as of this visit, was not helping her. And her pain is described predominantly on the left side. It's constant. Constant is something that means it's intractable. It's not going away. She is having achy, cramping, meaning muscle pain and cramps, which can be extremely severe. Sharp, shooting, stabbing, and just tenderness, which was referring to her tenderness of her skin, that just simple light touch of her skin was causing her to cry out in pain. She had, at the time of the visit, she had a current pain of 8 out of 10. The best that she's gotten is a 5 out of 10, which is still significant pain. And when the pain gets worse, you're talking about 9 out of 10, severe pain. So yes, I think she's having intractable pain, and I think she's having a significant increased pain to where she was not able to rest. And this is after starting to get some relief a few days before with a lesser opiate in Norco. So yeah, she's having severe intractable pain, and I think it needs to be addressed. So I prescribed her the fentanyl. Primarily, the fentanyl is prescribed because she's having increased difficulty with her swallowing. So we need to give her something that will give her constant low-grade pain relief throughout the day without ups and downs of drug levels fluctuating, and then have available for her immediate release pain relief for times when she's having significant pain, or if they're going to have to change diapers or change the bed, which would put her in even more pain.
What else?
The patient is short of breath. Still reviewing notes. And as far as I can tell from reviewing the note, I think that's the end of my answer.
Show you what's been previously marked as Exhibit 19 to your deposition. Is that right, Madam Court Reporter?
That's correct.
Thank you. Show you what's been previously marked as Exhibit 19 to your deposition. Have you ever seen that document before?
Yes.
And this is a list of the drugs that were administered to Shirley Couch. by
Objection.
Renee Bonner, with the dates and the times that those drugs were administered.
Objection to form, foundation, cause for speculation.
Join.
You may answer.
I see it's an exhibit. I see it's it appears to be a something on a check register, and it does list
Something on a what?
check register. It looks like it came out of a checkbook.
Okay.
It lists date. It lists a misspelled morphine, and it lists some times. I don't know who this is in reference to. I don't know if these were actually ever administered.
What makes you think these drugs were not administered?
I just don't have any basis for forming an opinion on that.
Okay. Did you see page 1 of Exhibit 19?
This is the exhibit 19 is this handwritten note. Is that correct?
you read the question back, please, Madam Court Reporter?
Question, okay, do you see page 1 of exhibit 19?
I can't tell what exhibit you're calling 19. What I see on the screen is a handwritten note. It looks like it's in a check register. It starts with 6/22 morphine, MORFINE, and then has a time of 10 p.m. Is that what you're referring to?
I'm referring to exhibit 19, which you described as what looked to you like a check register. You
Okay,
see-
yes, I see
And
it.
for the record, it's not labeled exhibit 19 in front of us, and that's what he's asking clarification of.
For the record, he identified it as exhibit 19 when we introduced the document several questions ago.
And he's not required to keep track of your exhibits. And if you want to be rude and not answer simple questions about whether or not this is an exhibit because it's not clearly marked on the screen, then we can end this. But he's asking, is this exhibit 19? Why is that hard to answer?
Yeah, I'm not here to answer questions. Do you have an
But you are here to be
You have an
respectful of
objection?
the witness.
Do you have an objection?
I do.
Make an
My
objection.
objection
You
is
can't make
that
speaking
he's
objection.
asking you if
What
this
is
is
this,
an
amateur
exhibit
hour?
for you to answer his question.
This amateur hour, man?
No, it's not. You're the only amateur. Okay, thank you.
Do you see where it reads 6/22?
Yes, I do.
And date format, that's June 22nd?
Yes, I believe that's what that refers to.
Well, there's not a 22nd month in a year, is there?
No, but I don't know whether or not it's 2017 or 2020.
Yes,
It's-
sir.
it's-
6/22 refers to June 22nd, does it not?
Yes,
Object to form.
And it
Join.
reads morphine.
I see something called morphine, MORFINE.
And to the
Yes.
right of morphine is 10 p.m.
Yes, I see that.
And can you tell from this record how much morphine was administered at 10 p.m. on June 22nd?
No.
Objection calls for speculation, foundation.
You see
Join.
it reads June 23rd, hydrocodone.
Same objection.
Join.
Answer.
I see the date, what appears to be 6/23. It says hydrocodone and a time. It doesn't say whether anything was administered or how much.
Yes, sir. And hydrocodone is also referred to as Norco.
Yes,
And
is correct.
you prescribed Norco or hydrocodone to Shirley Couch on June 16th, 2017, June 20th, 2017. True?
I believe those were the dates, yes.
And below that, it reads 0.25 morphine, 7:30. Is that right?
Objection, foundation calls for speculation.
Join.
I see something written on the piece of paper that says 0.25 morphine, 7:30.
And beneath that, it reads another 0.25 morphine, 7:45.
Objection, foundation calls for speculation.
Join.
The answer.
I see that.
Beneath that, 0.25 morphine, 8:33.
Objection, foundation calls for speculation.
Join.
I see that note as well.
Beneath that, 2, do you see the numeral 2 circled?
I do see it.
And diazepam.
I see that too.
And diazepam is also a drug that you prescribed Shirley Couch in June of 2017, is it not?
That is true.
And it reads 8:45 to the right of the 2 diazepam. True?
That is true.
And on the next page of Exhibit 19, do you see that where it reads 6:23 on the left?
Yes, I see that.
And do you see where it reads the numeral 5 circled diazepam, 2 tablets?
Objection, foundation calls for speculation.
I do see that written on the paper.
And can you tell by that note whether on June 23rd, how many diazepam tablets were administered?
Objection. Foundation calls for speculation.
Join.
I don't know that she was admitted anything. This could be somebody keeping track of her tablets. I don't know whether or not they're being given to her. I don't know whether or not they're dispensing it or throwing it away. I do notice that if you look at the previous note, they've got a 2 circled, and now they've got a 5 circled. And then they say 2 tablets. I have no idea what that means.
Objection moved to strike as non-responsive. Would you read back my question, please, Madam Court Reporter?
Question, and can you tell by that note whether on June 23rd, how many diazepam tablets were administered?
Same objection, asked and answered.
Join.
I can't tell whether or not there was anything administered.
And beneath that, you see where it reads June 24
I see that.
at 6 o'clock, morphine 0.5.
I see that.
Beneath that, 9:30, morphine 0.5.
I see that as well.
Beneath that, 11:02 diazepam, 1 tab.
I see that as well.
Beneath that, 3 o'clock, morphine 0.5.
I see that as well.
Objection
Are
vague.
those all drugs that you prescribed to Shirley Couch in June 2017?
They are.
Moving on to the next page of Exhibit 19. You see that document?
Yes.
You see at the top, given 425.
Objection. Foundation calls for speculation.
Join.
I see that.
Can you tell by that note what was given, how much was given?
No, I can't.
Objection calls for speculation.
You see beneath that where it reads 330 diazepam, 0.25 morphine on that first line?
Yes, I see that.
And can you tell by that how much diazepam was administered at 3:30?
Objection.
Objective.
Foundation calls for speculation.
You may
I-
answer.
I can't tell that anything was administered.
And you see the next note beneath that, 530 Ativan?
Yeah, I see that.
Can you tell by that note how much Ativan was administered?
Same objections.
No, I can't tell how much was administered, but the note beside it says sleeping. So I wouldn't expect anything to be given. I can't tell whether it was given or not, but if the patient's sleeping and resting, that's off schedule. They should not be given any kind of dose of anything.
You see to the right of that, 0.5 morphine?
Yes, I see that.
Diazepam, Ativan, and morphine were all drugs that you prescribed to Shirley Couch in June 2017.
That's
True?
correct. That is correct.
You see the line beneath that, 730 diazepam, sleeping, 0.5 morphine?
Object to form.
Join.
Yes, I see it.
Diazepam and morphine, those again are drugs that you prescribed to Shirley Couch in June of 2017.
I did prescribe those drugs, but I did not just prescribe for them to be given while she was sleeping and resting. They are to be given. The morphine is to be given for pain and shortness of breath, more shortness of breath. And the diazepam was only to be given if the patient is having cramping muscle pain. So that would also be off
Your
schedule.
note about sleeping and muscle pain.
Please repeat that.
Could you read it back, please, Madam Court Reporter?
You were talking over each other. I think you said, show me the note about sleeping and muscle pain.
You're going to show me that, Dr. Shiver, in your physician's orders where it says these drugs are only to be given as you just testified under oath, not while sleeping or for muscle pain? Show me that, please, sir.
No,
Object to form.
Join.
What?
I did not say that.
You didn't just testify to that?
I said that the patient should be given morphine if there is pain or shortness of breath. And I said that the patient should be given diazepam if she's complaining of cramping muscle pain. If she's sleeping, I'm not sure how she can complain of pain or cramping pain. So that's what I'm testifying to.
Beneath that, 930 Ativan, sleeping, 0.5 morphine. Do you see that?
I see that as well.
Also drugs that you prescribed to Shirley Couch in June of 2017.
Ativan is supposed to be prescribed for anxiety. If she's sleeping, she should not receive a dose. I mean, she can't complain of being anxious. And if she's sleeping, she's not anxious. So even if this report is accurate and these are things that are being administered to her, they are being administered off schedule, off instructions.
And where are these instructions?
They're part of the prescription. It says, you read those to me. You said morphine to be given PRN, pain and shortness of breath. And you showed me the written prescription that said Ativan to be given PRN, anxiety. And you showed me the other thing that says a prescription written that I signed, diazepam to be given PRN, meaning as needed, for muscle pain, muscle cramps. That is the instruction. That's the schedule. The diazepam, the morphine, and the Ativan are not there to be given in any other event or circumstance.
Other than what's in your physician's order.
Correct.
And those are the physician's order we covered earlier.
That's correct.
All right. There are no other physician's orders regarding those drugs that you prescribed to Shirley Couch in June 2017.
No. Not that I'm aware of.
It reads immediately beneath that. You see that star, any pain at all, give 0.25 morphine?
Yes.
Was that part of your order?
Not as far as I can tell. That's not, I haven't given that. That's not on my signature there. I don't think that's been documented anywhere in the entire record that you've shown me or that I've reviewed. This is on a piece of paper that does not have a name on it and is questionable about its accuracy.
You see beneath that, June 25th, 3 a.m., morphine 0.25, diazepam, 1 tablet.
I see that as well.
Again, both drugs you prescribed to Shirley Couch in June 2017.
That is correct.
Beneath that, 345 morphine 0.5, again, a drug you prescribed to Shirley Couch in June 2017.
That is correct.
Beneath that, 430.25, can you tell what drug or how much drug was administered there?
Object to form.
Join.
I don't know that any drug was administered there, and they don't even list a possibility.
Beneath that, 8:48 a.m. morphine, 0.5. Do you see that?
I see where those words are recorded.
Again, a drug you prescribed to Shirley Couch in June 2017.
I did prescribe morphine in 2017, June.
Beneath that, 8:57 diazepam, 1 tablet, another drug that you prescribed Shirley Couch in June of 2017.
That's correct.
Beneath that, 8:59 morphine, 0.25, another drug you prescribed Shirley Couch in June 2017.
Again, I see that is recorded. Whether it's administered, I have no idea.
Beneath that, again, morphine, 8:59.25, a drug you prescribed to Shirley Couch in June 2017.
Yes, again,
Beneath that, 9:39, 10:03, and 10:30, 0.5, 0.25, 0.25 respectively. Can you tell what drugs were administered there?
Objection. Foundation calls for speculation.
I have no idea what was it. And I have no idea what was administered.
When was the first time you saw this document, which has been marked as Exhibit 19 to your deposition?
A couple of weeks ago.
All right, so that was in May of 2021.
I don't recall the exact date. I believe it was in response to the notification that we were going to have this deposition. And I think that was 2 or 3 weeks ago.
All right, it's May 21st today.
Right.
3 weeks, 7 days in a week is 21 days. So that would have been sometime in May of 2021, true?
I can't remember when I was first notified of this. It might have been at the end of April.
All
So
right.
whenever it was done, I was given some records to review. Some of this stuff came, or I didn't receive them all at the same time. So I'm not sure exactly when I noticed this particular record.
So
But-
the earliest you would have seen this document, April 2021.
Yes, that is correct.
And you cared for Shirley Couch last in June 2017.
Yes.
So you didn't see this document for 4 years after you cared for Shirley Couch?
I've not seen this file. The deputies' body cams and stuff do have them holding some paperwork. But I don't know what it was, and I can't identify it as this being that.
Next page of Exhibit 19. You see where it reads Mrs. Couch at the top?
I see that.
And you see 3 columns. Column on the left, 1 milliliter morphine. Again, that's a drug you prescribed to Shirley Couch in June 2017.
I did prescribe morphine.
The middle column is Ativan, another drug you prescribed to Shirley Couch in June 2017.
I did.
And the third column is Valium, another drug you prescribed to Shirley Couch in June 2017.
I did.
And 11:30 under morphine, 1 milliliter, that blank is checked. Is that right?
Yes, it's checked.
And there's a blank checked under Ativan.
Yes.
Did you intend morphine and Ativan and Valium to be administered to Shirley Couch at the same time?
It depends on the situation. If the patient is having severe pain and they try to relieve that pain with morphine, and she's having severe muscle cramps and stuff, it's possible that could be given then.
And which of your orders, was it the one on the 6th, 16th, 20th, 22nd, or 23rd, where I missed that?
Yes, what?
What you just testified to that was part of your order regarding these drugs?
I don't know what you've missed.
I want to know which of those orders contains the language you just testified to under oath at your deposition, doctor.
You pointed them out to me. You told me that, and I saw the written prescriptions for morphine to be given Q2 hours, PRN pain or shortness of breath, and Valium to be given PRN. I believe it was up to every 4 hours. I'm not positive, pretty sure it's up to every 4 hours. If the patient is having muscle spasm. So that's what I just testified to.
So you did intend for these to be administered at the same time to Shirley Couch in June 2017.
I can see that there might be a situation to where they might be given at the same time.
Yes, sir. And that's while she was also wearing a 50 microgram fentanyl patch. True.
That is correct.
Objection to
That
form.
you also prescribed.
That is
Yes.
correct.
Now beneath that, 130 and the left, 1 milliliter morphine, again, a drug you prescribed to Shirley Couch in June 2017. That box is checked. Is that right?
I'm not sure what that means. Yes, it is checked.
And over on the right under the volume column, another box is checked for 130.
Yes, I see that that is checked. I don't
Does
know what
that
that means.
I'm sorry.
I don't know what it indicates. There's no way for me to tell based on this.
Does that indicate to you whether Valium and morphine were both administered to Mrs. Couch?
Objection to
Objection to
form.
form.
Foundation calls for speculation.
You may answer.
I don't know if it was administered at all.
And you see beneath that 330, left column, there's a check mark, 1 milliliter morphine. To the right of that, again, 330, there's a check mark under Ativan. Does that indicate whether those were administered to Shirley to Shirley Couch with the morphine at the same time?
I have no idea.
Objection to form.
Again, those were both drugs that you prescribed to Mrs. Shirley Couch in June 2017.
That is correct.
Beneath that at 340, you see that 1 milliliter, there's a box checked again under the morphine column.
I see a box checked. If that's done, then that would also be, if that was administered, that would be off schedule in contradiction to my orders.
And you have a policy procedure that enables you to determine when drugs are being administered contrary to your orders, do you not?
In what instance are you talking about?
That's my question, doctor.
I give orders to the nurses. They advise and educate the patients and the family members on how to administer these safely. But there is no requirement or record that I know of that is available. And certainly this doesn't seem to qualify for that.
You've heard the term analgesic.
Yes,
Morphine's an analgesic.
yes,
Fentanyl's an analgesic.
yes,
Opioids are analgesics.
Yes.
Benzodiazepines, analgesics?
You wouldn't qualify them or classify them as analgesics, although if you have severe muscle pain and cramping, Valium is a very good muscle relaxer, and that way could relieve pain, but I don't think it's qualified or classified as an analgesic.
You see at 4:30, it reads 1 milliliter morphine. You see that box is checked?
I see that there's a box checked. It says 1 ml, and
Right,
it's under the morphine column.
right. ML stands for milliliter, right?
Yes.
5:30 is, to the right of that is again 1 milliliter under morphine.
Yeah, I see that.
And to the right of that, at 5:15, there's a checkbox under the Ativan column.
Yes, I see that.
Both drugs that you prescribed to Mrs. Shirley Couch in June 2017.
Yes, I have prescribed those drugs. I see those documented on this document.
Yes, sir.
But if these are actual dosages, if these are, and they are actually administered, then they're being administered way too frequently. They're not documenting why they're giving it, whether or not it's for anxiety or muscle relief, muscle pain relief, or in response to pain or shortness of breath. So I can't tell if these are being administered correctly. Also, if you look at this document and you look at what's documented as being dispensed by the pharmacy, and you look at what was documented as being left over by the deputies, then mathematically, this entire document is inaccurate and subject to me questioning everything on it because it's not relaying information accurately.
Yes, sir. You see 6:30 under
I
the
see that.
morphine column,
Yes.
1 milliliter, and under Ativan, 1 milliliter. And there's another milliliter with 605 next to it. And then under the Valium column, 718 and 737.
Yeah, I see that. I don't know if it was administered. If it's administered, why would they record it under Valium or Ativan? If it was administered, it is also far off schedule. They're going way too frequently as opposed to what the medication orders were.
But any of these drugs have been able to be administered had you not prescribed them?
No,
Object to form.
See beneath that 730 morphine, 1 milliliter, Ativan, 1 milliliter,
I see those notations.
and 930 morphine, 1 milliliter.
I see that notation.
show you what's been previously marked as Exhibit 20 to your deposition. Have you seen this document before?
No,
This is a picture of Shirley Couch taken on June 22nd, 2017. Did she appear to need fentanyl and morphine and Ativan and Valium and an antipsychotic medication to you?
Objection, foundation calls for speculation. Sorry.
Answer the question.
first of all, an antipsychotic was never dispensed. I don't know that this comes from or what date this was taken. She appears to be sitting up in bed and not in pain. She appears to be relaxed.
Yes, sir. And my question was a little different.
Okay.
Does the patient depicted in Exhibit 20 appear to you to need a 50 microgram fentanyl patch, morphine, Ativan, and Valium? Do you understand the question?
Yes, I
Object
do
to
understand.
form.
What is the answer to the question?
This patient does not appear to be in significant pain and therefore not requiring, at the time that this picture was taken, any of the above medicines. However,
And
she could easily actually have a morphine patch on and have just been given a dose of medicine to help to relieve her pain. So I can't tell from this whether she's had it. It looks like she's got adequate pain relief for whatever time.
Sure. And the only reason or way for you to know that as a physician is to actually evaluate your patient. True?
Object to form.
The patient is evaluated by the nurses, and these are related to me. This is a standard hospice practice. It is understood by the federal government and the DEA. That's how we do this.
Show me in the nurse's notes for June 2017, where the Homestead Hospice, any of the nurses described Shirley Couch as she appears in this photograph. Just give me the page and the nurse and the
So let me see.
Object to form.
Join.
You may answer.
What's the date? The date?
I want you to show me any date where any nurse or any healthcare provider employed by Homestead Hospice describes Shirley Couch appearing as she does in this photograph.
Object to form.
Objection, foundation.
I would say June 19th, LPN visit, Christy Fowler.
All right. Which portion of that note?
Patient sitting up in bed. That's on page 3 of 4. The daughter's home. Patient's pleasant and cooperative, alert and oriented.
All right. Anything else?
Well, the nurse's visits occur maybe 40 minutes to an hour and a half or so. Sometimes they stay longer than that. They certainly aren't there the 24 hours a day, 7 days a week. So there could have been other times to where she received pain relief and she looked like that. But I don't know of any other place documented in the records to where it would appear where she is, like as she is right there. in that photograph.
I'll show you what's been previously marked as Exhibit 21. Have you ever seen that document before?
No.
Does this patient appear to be in better or worse shape than she was in the previous photograph?
Object to form.
Objection. Foundation calls for speculation.
You may answer.
She appears to be somewhat obtunded. She is looking probably maybe a little dehydrated. She isn't grimacing or anything, so I don't know that she is in acute pain. She does have some wrinkles in her forehead, which might reflect a little bit of pain. And she's got looks like a swab in her mouth where she's trying to moisten her mouth. So she doesn't appear to be feeling as well as she did in the previous photograph.
He appears to be worse. True?
Object to form.
Join.
She appears to not feel as well.
Appears to be worse. True?
Object to form. Asked and answered.
Objection. Foundation calls for speculation.
You may answer.
I already have. Have you uploaded those photographs?
What?
Did you upload those photographs?
Yes.
Sorry,
Actually, I don't believe you did.
I don't see it.
Oh, in the chat?
It's not in the chat.
Hold on.
The last thing is handwritten note.
Get that? That brings us to 22, Madam Court Reporter.
The next one is 22, yes.
Thank you. Your initial prescription is for what's called an E-kit, true?
Yes,
An emergency kit?
yes.
Renee Bonner was a Homestead Hospice employee with no medical or nursing training, true?
I have no idea.
All right. Show you what's been previously marked. Is Exhibit 22. Ever seen that document before?
This is, can you
The plan
scroll,
of care for Shirley Couch.
can you scroll down?
Sure.
Up a little bit, page at a time.
Here, I'll just,
Okay, yeah, I have seen that.
now, according to CMS regulations for hospice care, you're required to participate in a plan of care for your patients, true?
Yes,
And you did that here?
yes,
And the plan of care is accurate?
yes,
And the plan of care indicates how Shirley Couch will be cared for over the course of her stay?
at least for the next 2 weeks, unless there's a change in status.
All right. Well, there's no second plan of care in the medical record. So what would that indicate? That her status did not change?
The plan of care can be altered by IDT on an ad hoc basis. So there will be changes to the plan of care.
Yes, sir. SN, that stands for, I think you testified earlier, skilled nurse. Is that right?
Yes, I think so.
You see on page 2 of 4 where it reads interventions?
Yes,
Interventions are what you do for your patients at Homestead Hospice, true?
I believe that's a fair interpretation. Yes.
And if we look down at interventions, we'll see, you see this, it starts out aid, do you see that?
Let me pull this up. You're moving it so much I can't actually follow what you're doing. This is what page of
You just let me know when you're ready to continue, doctor.
well, I can't actually find that in the hospice record. If you could just be slower in how you are scrolling it.
Yeah, I believe there's also a copy in your chat. Do you see that?
All right, where would that be? Oh, the plan of care. All right, great. All right, great. Thank you. All right, and what was your question?
Interventions are what Homestead Hospice does for its patients. True.
Yes.
And you'll see aid, that's a nursing aid, is that right?
Aid. I think I believe that's in reference just to a nursing aid. There might be other types of aids. I'm not sure.
Yes, sir. But these are interventions where it reads aid.
Yes.
Those are interventions that the aid handles, right?
Elimination. These all appear to be things that a nurse's aide would do.
Yes, sir. And for SN or skilled nurse, those are interventions that a skilled nurse handles. True.
Yes.
And for IDT, that's what the interdisciplinary team handles. True.
I'm not sure that follows. I think I've never seen that kind of notation before. I'm assuming that it's actually probably something skilled nurse handles. It might be directed by IDT, but
You see where it reads under intervention that the skilled nurse is the one to administer analgesics as prescribed by MD.
can administer analgesics as prescribed by MD.
Where does it say can?
The skilled nurse is not going to be there 24 hours a day, 7 days a week.
Yes, sir.
So she's not going to be able to administer all the medications that are needed. If she's there, and if she is aware of the situation to where it meets the parameters of the medication order, then she'll administer the analgesic. Or she might teach the patient to administer the analgesic, or watch the patient take it, or watch the caregiver take it. I mean, it varies, but she can't take it.
Show me the plan of care that is required by CMS where it reads that the family members give the analgesics including the opioids, the fentanyl, morphine, etc.
Objection to plan, objection to the extent it misstates the legal requirements. You can
You may
answer.
answer.
I don't know of the exact forms and stuff, but these are all medications that are routinely administered by family members
Yes, sir.
with education and by the nurses, and how to administer them and what to look out for as far as like possible side effects.
Yes, sir.
And they are also instructed on following the schedule, which means the instructions on when and when they cannot administer medicines.
So the nurses are required to instruct the family members on the administering drugs.
Yes.
And there's a note about that here as well. Is that right?
Form.
Yeah, it says skilled nurse, SN, teach pain management and comfort measures. SN teach regarding medicines to include dosages, administration, actions, side effects, possible interactions. And if needed, to report to the RN if there are questions.
Yes, sir. Well, you left out, there's a little more to that, right?
Let me see. I don't see it. Where?
Reach target date 9/2/2017. True.
That's not on my copy. But on the copy that you're showing me,
Reads at page 304.
Okay, what this is,
Patient will demonstrate understanding of appropriate use of meds for pain management. Target date 9/2/2017. Do you see that?
I see that.
See immediately above that, patient caregiver will verbalize understanding, demonstrate compliance and independence of medication regimen
Yes.
and signs and symptoms of adverse reactions to report. Is that right?
Yes,
Target date 9/2/2017. Yes.
yes,
Patient caregiver administers medications appropriately with the understanding of side effects and states implications and expected results. Target date 9/2/2017.
yes, that's what it says.
So that's September 2nd, 2017, right?
Basically, what you're talking about is the end of I believe it'll be the first certification period. And the program automatically places that as a target date to make sure that they are 100% reliable by then. I don't know that this carries any other meaning except just a notation by the computer for the end of the first certification period. She was admitted on June 2nd. Target date for everything to be completed is September 2nd. That does not mean that the nurse has not instructed the patient on all the things that we listed about the giving medicines, giving the dosages, the correct way to administer medicines, and the possible side effects and interactions, and has received confirmation from the patient that they understand these. That target date, September 2nd, doesn't mean that there is anything other than a computerized target date. The patient has been instructed and expressed an understanding to the nurse's satisfaction.
I'd like to take a break if we're at a good point, James, Rhonda.
Sure. I've got a document, doctor, your trial transcript. We're going to
Okay.
mark this as exhibit 22. I'm going to go ahead and upload this.
It's exhibit 23.
And I'm going to ask you some questions about that. One,
Okay.
whether everything that your testimony is true, except for the board certifications, I suppose. And we'll take a break. How long do you want to review that?
How
How many
long
pages is it?
What?
How many pages is it?
I don't know.
Well, I think he would need to know that before he gave a time frame as to how long it will take him to review it.
Remember how long your testimony was at trial, Dr. Shiver?
Several hours.
You sure about that?
Sure seemed like it.
All right, we'll take a break. How about half an hour? You let me know if you need more. Is that all right?
Okay. Is there anything in particular you want me to review?
No, sir, the whole thing. I need to know whether there's anything in there that's inaccurate or untruthful.
Okay.
All right?
All right.
Going off the record at 4:16 p.m. We're back on the record at 5:13 p.m.
Dr. Shiver, I'd like to know which of your answers are false in your trial transcript testimony, other than your answer about you being board certified.
I'm going to object to the form of the question to the extent that he was not provided with the accompanying exhibits that are referenced in his testimony. Over that objection, you can answer, Dr. Shiver.
When I was reviewing it, there was at least one point that I was confused on.
What point is that, Dr. Shiver?
About whether or not nurses could administer the medications themselves. It
What
was,
page are you on?
I don't know, it was mentioned several times.
I need to know what answers of yours are false, other than your answer about you being board certified in family medicine, sir. Beginning with the first page of your testimony.
An objection.
All right. Page 133.
Yes, sir.
So the nurses, but controlled substances, they don't do that.
What line number?
133, line 25, 134, line 1. Basically, they can administer. And I was confused at the time because there was a law stating that nurses can't pick up or retrieve controlled substances, that the family has to do that. I extended that to mean that they couldn't do actually administer themselves. But I was confused. They can address that later in the thing. Basically, that I thought it would be a homestead policy instead of an actual law. That would be
Bless you.
Oh, thank you.
What is your confusion at 133, line 25?
that nurses don't administer controlled substances, that there was some rule passed or regulation passed that they couldn't administer them. Actually, it seems the rule itself only meant that they couldn't pick them up from a pharmacy and that they couldn't transport them and that they couldn't dispose of them.
Your understanding now is what?
That they can administer the
Nurses
medication.
can administer controlled substances.
Yes.
All right.
And there's another mention of that. I believe, on cross-examination.
Any other false answers other than that and your answer regarding your board certification?
Object to form.
You may answer.
I'm looking. There's that same premise about the nurses not administering narcotics is addressed later in the transcript.
What page and line?
I'm trying to find it. All right, this is addressed again on page 161, line 10. Nurses instruct patients and the patient's family as far as controlled substances go. I'm pretty sure nurses aren't going to actually be handling the drug to administer it. They might check doses and stuff to see how many are actually, might count the doses and make sure they've been given. It depends on whether or not they suspect that there's a need to do that. But they don't give medicines and they don't dispose of medicines. That's along the same lines of the fact that they can actually administer the medicines.
So your testimony in February of 2019 was that Homestead Hospice could not administer controlled substances to patients like Shirley Couch. And your testimony today is that Homestead Hospices could administer drugs like controlled substances to patients like Shirley Couch.
Object to form.
The testimony that I gave at trial was confused. That it was inaccurate. And looking at things as they stand that I know as they are now, yes, they can do that. At least at the time this was all happening.
Yes, sir. And what between February of 2019 and May of 2021 caused you to change that testimony from nurses cannot administer those drugs to nurses can and do administer those drugs?
Review of the entire record. When I first received these records, there was a lot missing. I didn't actually see the entire record until in the last 4 weeks, 6 weeks.
Now, what about this record would change your view about whether nurses can administer controlled substances? You were the medical director at Homestead Hospice from 2013 to 2019.
Right.
Object to form.
I'm I'm not actually in the house watching nurses give medicines or the patients give medicines. I'm directing and supervising, but that in that instance, they I was confused. I confused their statements and the policy that they can't give the medicines when it actually they could. The confusion was that they couldn't actually transport medicines or dispose of them. So yes, that's different. When I reviewed the entire records and stuff, it's obvious that that was different.
Sir?
So that's
Were
why I
you also-
changed my testimony.
Were you also confused earlier today when you suggested that the comfort kit, the drugs that you prescribed to Shirley Couch on June 2nd, 2017 were never provided to Shirley Couch?
Object to form.
Join.
You may answer.
When I ordered the e-kit, I expected it to be dispensed.
Yes, sir. And why did you testify earlier today that it was not dispensed and not provided to Shirley Couch?
Object to form, misstates testimony.
Join.
Because when I review the records, the CVS records, which I just got, they did not dispense anything until the 23rd.
Yes, sir. But as a medical director at Homestead Hospice, you knew full well that that comfort pack, what you prescribed on June 2nd, 2017, was delivered by the Homestead nurses and not provided by CVS. True?
No, they couldn't. They don't have morphine.
Go ahead,
They could,
Doctor. Yep.
the Homestead nurses do not have morphine. That has to be dispensed by the hospice, by the pharmacy.
Yes, sir. Then how do you explain Julie coming out and picking up the remainder on the 28th?
Object to form, calls for speculation.
Join.
Because it was dispensed on the 23rd and the remainder would be still there. But I'm sure Julie didn't take it.
How are you sure she didn't take it?
Well, for one thing, they're not supposed to transport it. The second thing is it was still there on the deputy's camera video.
So your testimony, again under oath today, is that the drugs that you prescribed on June 2nd, 2017 were never provided to Shirley Couch. Is that right?
Object to form.
Join.
You may answer.
I believe they were provided on the 23rd.
You think the drugs that you prescribed on June 2nd were provided, but not provided until June 23rd?
Yes,
Okay. You testified earlier that she never got those drugs.
no, I said they weren't dispensed until the 23rd.
Make sure we're talking about the same drugs, doctor.
Okay.
I'll show you what's been previously marked as an exhibit in your deposition today, which is your physician order
Yes,
dated June 2nd, 2017. That's your signature at the bottom.
yes,
And this is also referred to as the comfort pack, the comfort kit, the emergency pack. True?
yes, that's true.
And these drugs are provided to the patient by Homestead Hospice, right?
They're paid for by Homestead Hospice.
Yes,
we
sir.
don't- I don't they're paid for. I don't know that they're actually in the office or available. I know for sure that morphine and lorazepam would have to be dispensed by the pharmacy.
Yes, sir. You said you didn't know whether they were in the office, but you know that they were provided to Shirley Couch.
I
True?
believe, well, let's see, where is the, I'm trying to find the, CVS list of medicines. Okay, let's see. There was only 30 cc's distributed from CVS for morphine sulfate. And the lorazepam was done that at the same time. Those were both on 6/23. And then the 2 hydrocodone on 6/16 and 6/20. The fentanyl patch on 6/22. Diazepam on 6/22. Now, these are CVS descriptions from 9/2016 through 9/2017, and there's nothing else dispensed. And I know Homestead doesn't have that. We don't dispense medicines. We order it, and when it's needed, they're picked up at the pharmacy.
And your testimony under oath is that the drugs that you prescribed on June 2nd, 2017, then were not received or available to Shirley Couch until about 3 weeks later on June 23rd. Is that your testimony under oath?
Object to form, misstates this testimony.
You may answer.
That's what the record shows.
Yes, sir. Let me show you what's been previously marked as, are we at 23, Madam Court Reporter?
24.
24. Thank you. Now, you only worked at Homestead Hospice as a medical director part-time, right?
Yes,
Your full-time job was at Athens Family Practice.
that's correct.
Show you what's been previously marked as Exhibit 24. Do you see where it reads DME order form?
Yes,
Do you know what a DME order form is?
I believe it's for medical equipment.
Yes, sir. And I'll show you what is a Optum Hospice Pharmacy Services.
Oh,
You
okay.
see where it reads Optum Hospice Pharmacy Services?
Yeah, I see that.
Have you ever heard of Optum Hospice Pharmacy Services?
Yes, they're sometimes used.
Yeah, they sometimes use to get drugs, right?
Yeah. Yes,
Yeah, you of course know that CVS is not the only place at Homestead Hospice gets drugs for patients. True?
as far as I was concerned, all the records that I showed that CVS was the only thing that had the drugs.
Sir, I'm
Never.
not, yeah.
All I'm trying to tell you is that's the first time
I
I've
want you
ever
to tell
seen
me the
that.
truth.
I'm telling you the truth. That's the first time I've ever seen that.
Yeah,
And
well,
James,
just
I'm gonna
because
need
it's
you
the
to
first
calm
time you've
down.
seen the document doesn't mean you can be untruthful about the facts. Do you understand that, doctor?
James, I'm going to end it if you don't lower your voice. He has testified repeatedly that he was basing his opinion on his review of the CVS records. If you would like to show him additional records, you will do that, but you will need to lower your tone talking to my client.
This man has already lied under oath in front of a
He
superior
is not
judge
lying
and
under
12
oath.
jurors in a courtroom in a criminal trial in this state. He's committed perjury. It's a felony.
He's
You
not, but
understand?
would you like to ask your question?
I already asked the question. I have a
Do you need it
question.
read
Have
back,
you
Dr.
reported to
Shiver?
the district attorney that you lied to him about your board certification, sir?
Object to form.
Have you reported that to the DA yet?
I didn't actually realize that that would be considered lying. No. I did have board certification. The fact that it had lapsed didn't cross my mind that that was inaccurate.
You weren't asked whether you'd ever had board certification. You asked whether you were board certified, and you said, yes, sir, and that was false under oath in a superior courtroom with a judge and jurors in the courtroom. True?
Object to form, asked and answered. This is the last time I'm going to allow him to answer it.
Yes,
I'll show you what has been marked as Exhibit 24. Did you see it?
no.
Can you see it now,
Can you upload it?
sir?
Can you upload it to the chat?
They won't. Already did.
Okay, thank you.
You're welcome.
Okay,
You see that?
yes, I do.
So does that, you now agree that Shirley Couch got those medicines that you prescribed to her on June 2nd, 2017, on or about June 2nd, 2017?
I don't see all the medicines there.
Do you see where it reads Comfort Care Kit?
Yes,
The Comfort Care Kit includes the morphine, does it not?
no, it's actually additional. It's not a normal thing. It would only be given to patients that were in pain, and a lot of the patients are not in pain. It looks like active medication profile is Cipro, Colace, Cymbalta, hydrocortisone, Miralax.
So are you
So
saying, again?
I'm saying
Dr.
that,
Shiver,
I'm
no, I was asking a question and you began again.
okay,
Are you saying, Dr. Shiver, that, well, 3 witnesses are going to testify that a nurse brought out the comfort kit with the morphine? You do recall, it sounds like you've spent a lot of time with the records regarding the nurses sharing the instructions on the use of the comfort kit. And a
Yes.
nurse testified about the use of the morphine from the comfort kit. And all 3 of those witnesses and the Julie who picked it up are lying. Is that your testimony?
Object
No.
to form.
no, I'm not saying that. I'm saying that it's listed as a comfort care kit here
Yes, sir.
on this order.
Yes, sir.
And I was not aware that the actual comfort care kit that routinely contained morphine.
And now you are aware of that.
I'm not sure. I haven't seen anything so far, but if the nurses are saying that they delivered morphine, then they delivered morphine.
Yes, sir. And you understand the difference between saying, I don't know, and that this patient didn't get this medication for 3 weeks later, and she only got half what you're talking about, right?
Object to form. Misstates his testimony.
I'm saying that with the available records that I had, I did not see where she was dispensed any morphine before the 23rd. And
Yes,
so
sir.
I based the total amount on that.
Yes, sir. Are your answers based on your knowledge or just what you can read in the medical record?
It's based on what I can read in the medical record because I can't remember the actual events.
Yes, sir. You don't have any recollection of Shirley Couch
No,
or her case?
just what I've read,
Yes, sir.
and just what I've read right before the trial.
Yes, sir. And of course, you never met her, so you don't have any recollection of her individually, right?
No, not that I recall.
That's correct. It's correct that you never met her,
Yeah, I believe that to be true. I don't think I've ever met her,
right?
except unless there was something in the record about her being my patient in the distant past.
Yes, sir. But you reviewed the record carefully and you didn't see anything like that, did you?
No,
Object to form.
Now, back to your trial testimony in open court under oath in Renee Bonner's criminal trial. You were telling me what in there that you answered that was false other than regarding your board certification. I'd like for you to tell me what else in there, what other answers are false.
Object to form. Same objection.
That's pretty much all I can see. I can't see anything else.
All right. I'm going to show you what's been previously marked as Exhibit 25. Is that right?
That's correct.
Thank you. You ever seen this document before, Dr. Shiver?
I don't know if I've seen this exact document.
Yes, sir.
Um,
That wasn't
I
this-
would, wait a
Go
minute. I don't know if I've seen this exact document, but I've probably seen something similar to this.
So you were aware before today that the home e-kits or comfort kits, care packs, comfort packs contain just these drugs then, true?
I don't recall that this exact list was in the e-kits that I was doing in 2017, but they could be.
Yes, sir. Well, this is the exact list of what you prescribed to Shirley Couch on June 2nd, 2017, true?
Yes, it does look like it.
Yes, sir. And this was also an exhibit used in her criminal trial. Were you aware of that?
No,
Objection calls for speculation.
but I will say that when I ordered these, I did expect them to be dispensed. My confusion was the fact that CVS didn't have a record of it.
Yes, sir. And you expected these to be dispensed on June 2nd.
Yes,
True?
I
You
did.
expected those to get to your patient on June
Yeah,
2nd.
I
True?
did. Well, June 2nd or June 3rd,
Yes, sir. Or on or about June 2nd, right?
right?
And the
Yes.
reason is because you wanted those drugs, you prescribed them for your patient.
Yes,
Because your patient, you're there to care for your patient.
that's correct.
And your patient's safety is paramount, right?
Patient care is paramount, whatever form that takes. I'm certainly not going to do anything to endanger them. No,
Right. Well, there's nothing more important than your patient's safety. True?
Objection to the extent it calls for an incorrect legal standard.
You may answer.
I thought I did.
I didn't hear your answer.
I said I wouldn't endanger the patient. So yeah, safety is important,
Yes, sir. Well,
very important.
tell me what's more important than your patient's safety.
Basically, that the patient is well cared for, and that we give them good service. And I don't know of any reason. would do anything to endanger him. So paramount, yeah, I think safety is a good thing to strive for. I certainly wouldn't intentionally do anything that would endanger him.
Yes, sir. And when you suggested earlier that Shirley Couch didn't get this comfort kit, including that morphine, for 3 weeks, you said that not because you knew that, but because you couldn't find anything in the records showing you that she did get it, as
That's
is your
correct.
custom and practice within a day or two of you prescribing it. True?
Objective
That's-
form.
That is correct.
Yes, sir. So when you said that, you really didn't know when she got it. You just didn't find a record. So you surmised that she didn't. You suggested that she didn't, right?
That's correct.
And you also suggested that because that helps your legal case, because that means she was plied with less drugs if she had less drugs to be administered. True?
Objective form.
No,
All right. Now, it also helps explain when we were looking at Renee Bonner's handwritten list administering those drugs. You said the numbers didn't add up as far as the morphine.
that's
No.
true.
Objection to form to the extent that you're.
Let me finish. You can't interrupt. You can object after I answer a question. You can't
Sounded like
interrupt
you
me while I'm
stopped.
answering it.
It sounded like you stopped.
No, I didn't. Madam Court Reporter, would you read back my question, please, ma'am?
Question, all right, now it also helps explain when we're looking at Renee Bonner's handwritten list of medications. Hang on.
I'll ask it again. Thank you. You recall reviewing a handwritten document?
Yes,
And in that handwritten document, there were a number of drugs that you prescribed to Shirley Couch in June 2017.
yes,
Many misspelled,
yes,
and there were several pages.
yes,
And associated with those drugs that were listed there were dates and times.
yes,
And on one of those pages, there was actually the name Mrs. Couch. Do you recall that?
yes, I do remember that.
Yes, sir. And over the course of the cross-examination on that particular document, you said, this can't be accurate because there's too much morphine being administered here. True?
I said, I questioned the accuracy because it seemed like it was arithmetically incorrect.
Yes, sir. But knowing that, as is your custom and practice, the first bottle of morphine was actually provided to Shirley Couch and her caregivers and your colleagues on or about June 2nd, 2017, you know that there was enough morphine to make what appears to be provided there accurate. True?
Objective form.
Objection. Foundation calls for speculation.
I don't know that that was all administered, but it was certainly available.
Yes, sir. And thank you. And you did testify on cross-examination that you didn't know what, if any of those drugs were given, but if you add up the morphine there, that there was enough available, counting the comfort pack that you prescribed to Shirley Couch on June 2nd, 2017.
Objection
Yes.
calls for speculation.
Looking at the numbers, there does seem to be enough available for that.
Sorry, say that again, please. I just didn't hear it.
Looking at the numbers,
Yes, sir.
there does appear to be enough for that to be accurate. If it was administered, it's possible.
Yes, sir. And have you also read the Homestead Hospice nurses' depositions from June 2017 regarding the care of Shirley Couch?
I read one of them.
Which one?
Mary Allen or Teresa Allen.
Yes, sir. And that was She testified, you recall that they thought Renee Bonner and her help to care for her mother, her care was appropriate and in accordance with your orders. You remember that?
Say that again?
Can you read it back, please, Madam Court Reporter?
Question, yes, sir. Yes, sir. And that was, she testified, you recall, that they thought Renee Bonner and her help to care for her mother, her care was appropriate and in accordance with your orders. Do you remember that?
That still sounds confusing. Can you restate that?
Sure. You recall reading her deposition,
Yes,
and you recall me asking her about the care provided.
I don't recall a specific instance, but yes, I know you were talking about her care. Yes,
And I also asked her about Renee Bonner's role.
yes, I do remember that.
And I also asked her whether, in her view, Renee Bonner, what she did complied with your orders.
Objection calls for speculation.
You may answer.
Can I look at that?
Sure.
Do you happen to have that available?
I do not.
I think I can find it. Wait a minute.
What was the name of the deponent again?
Teresa Allen?
What's her name?
Teresa Allen?
Mary Teresa Allen,
Or
right?
Mary Teresa Allen? Okay. All right.
Well, I just want to, I mean,
All right. Do you recall about where in her testimony that was? He was talking about Renee Bonner. I think that was towards the end of your testimony or your.
you see it?
I think it's on page 140,
It begins at page 123.
123.
Here, let me read it for you, Doctor.
Okay.
You see it line 13,
On 123.
23.
Okay.
It reads, that's because you think Renee Bonner administered medication in accordance with Homestead Hospice practice.
I'm on the wrong page.
Okay. Numeral 23.
Oh,
You see that?
page 23.
Yes, sir.
All right, let me go up there.
Line 21. Do you see that?
Yeah, and that's because you think Renee Bonner administered medications in accordance with Homestead Hospice practice.
Yes, sir.
And then on line 20, she says yes. And then below that, and she also administered medications to Shirley Couch in accordance with Dr. James Michael Shiver's orders.
And her
And
answer
she's-
was what?
Yes,
And you didn't remember that?
I remember the conversation about you're questioning her about Renee Bonner. And I remember saying that she had confidence, but I didn't remember the exact wording about what you were asking.
Yes, sir. Now you remember that she said that Renee Bonner administered drugs in accordance with your orders. True?
Objection calls for speculation.
You see it there, right?
I believe you think that Renee Bonner administered medications in accordance with Homestead Hospice practice. Basically, she thinks that she did. Yes,
Mr. Shiver,
yes.
do you see line 21? I'm going to read this into the record. And I want
Okay.
you to follow me.
All right.
Question, all right. And she also administered medications to Shirley Couch in accordance with Dr. James Michael Shiver's orders. Her
She's-
answer is yes.
Yes, she did. That's what she said.
And you're Dr. James Michael Shivers, true?
Yes, I am.
And she was at the house with Shirley Couch, true?
Yes,
Objection
You were
calls for
not.
speculation.
True?
she was at the house with Shirley Couch some of the time. Yes,
And with Renee Bonner.
and some of the time, yes.
And you were not.
That's correct.
You never were.
That's correct.
And you agree with her testimony under oath at page 23 of her deposition. Renee Bonner administered those drugs in accordance with your orders. True?
Objection
Object
calls for
the form.
speculation.
I believe that's what she believes.
Yes, sir. And
I don't know that there's any, I do not know that there's any way she can actually factually say that.
And Mary Teresa Allen was one of the nurses under your charge as the medical director at Homestead Hospice in June 2017.
Yes,
True? And Mary Teresa Allen was one of the nurses charged with instructing family members on administering drugs in accordance with your orders. True?
yes,
And that's something you were ultimately responsible for. True?
I'm
Object the
responsible.
form.
I'm responsible for her instructing and administering medicines within the bounds that they were ordered on the prescription to be administered.
Yes, sir. Now, those responsibilities we reviewed earlier in your job description also required you to monitor the care for the patient, true?
Yes,
And to review the patient's records, true?
yes,
And to supervise the nurses that were caring for the patients,
true,
and to supervise the nurses that were instructing family members on how to assist in the care of your patients.
yes,
Object the form.
And what was that?
I objected to the form of the question.
All right. And also to ensure that they were complying with your orders. True?
Same objection.
You may answer.
Within the limits of what I'm capable of doing, yes.
Yes, sir. Well, you agree that you have to know what your nurses are doing.
I
Right.
cannot be in the car with them.
Yes,
I
sir.
can't
That's
be.
why you have to have policies and procedures in place to ensure that if there's an issue, it's addressed, and that would be addressed by you, the captain of the ship. True?
And that's
Object
what
to
we,
form.
You may answer.
that's what we do, IDT every 2 weeks. And if there's issues that crop up, we address the problems.
Yes, sir. Now, what is your role in hiring and firing nurses?
None.
Who's responsible for hiring and firing nurses? Is that Myron Falk?
I have no idea.
All right. Now, when you ask a nurse to help you with a patient, it's called an order, right?
What do you
Object
mean?
to form.
Oh,
What do you,
we can pull them up. It reads physician's orders on the top.
but what do you mean by help?
You
I'm
have
not sure.
Go ahead.
What do you mean by help?
You have nurses that help you care for patients, true?
Yeah, that is true.
And when you want a nurse to help you care for your patient, you issue what are called orders. Right?
Yes, yes.
It's not a discretionary act. You don't say, well, if you don't mind, would you administer this medicine to Shirley Couch? You order them to administer the meds. True?
I order them to administer meds within the limits of the prescription and schedule.
Within the limits of your order.
Right.
Do you keep time records when you were at the Homestead Hospice?
No,
Do you have any other moonlighting jobs now?
no,
Did you have any other moonlighting jobs when you were moonlighting at Homestead Hospice?
no.
Those two pictures of Shirley Couch, between the first one on the 22nd and the second one on the 27th, what changed?
Object to form.
Objection, foundation calls for speculation.
Let me answer.
Let me look.
I'm gonna have to take a short men's room break in 5-10 minutes, all right, Dr. Shiver?
Sure.
What, you have a preference? I mean, you need a break as well, or no?
5 minutes is fine.
Very well.
Going off the record at 6:10 PM. We're back on the record at 6:15 PM.
Dr. Shiver, do you have any issue getting your June 2017 mobile telephone records to your lawyer?
You're muted.
I can't hear you, man.
I'm not sure how to do that. Just call the Verizon Wireless and ask for that particular date.
I assume, yes, you can get that month from Verizon.
Okay,
If you go at AT&T, we can get them for, I think it's like 15 years, but I mean, I'm pretty sure that 4 is not a big deal.
okay.
Do you have any issue doing that?
No,
All right. I'll show you what has been 26, Madam Court Reporter.
Correct.
Man. I show you what has been marked as Exhibit 26, your deposition.
Which was, what is that?
That's,
Her
Uh,
pictures,
sir?
her pictures?
No, but we can do that again if you want to do that.
Well, I thought you were asking about that.
Yeah, I was. Do you want me to pull those pictures back up?
Well, I pulled them back up. You were saying something about the pictures. Now,
Yeah, the
you've repeatedly said that there was, this was the one where she's sitting up in bed was on the 22nd. How do you determine that?
I'm not here to answer your questions, sir. That's my issue, and I'll
Okay,
tell
that's,
you with 100% certainty that I will prove that at trial.
okay. It just looks like, more than 5 days worth of difference. She looks like she's lost weight, a significant amount of weight.
Yes, sir.
Um,
Anything else?
well, the one when she's, I assume that's a picture taken in the hospital. She's certainly more somnolent, which could be from medications. It could be also probably is from her urinary tract infection for which she was being treated.
Yes, sir. Did you read Dr. Singh's diagnosis in the Athens Regional Medical Center medical record?
I did.
Did you agree with it?
Which one?
Well, the one you read in her medical record.
I'd have to look back and see.
Sure.
I believe she said that there was, that she was overdosed,
Yes.
but I don't recall her saying anything about the urinary tract infection. Did she say that?
Well, I believe she did, but I don't recall. But do you agree that with Dr. Singh's diagnosis of Shirley Couch at Athens Regional Medical Center after she was out of your care that she was drug overdosed? Shirley
Object to
Couch.
form.
I believe that was her opinion, and I think she was the doctor on site, and that's what she said. I know that she got some incorrect information, but I would trust her to make the diagnosis.
Yes, sir. All right, I'll show you what has been previously marked as Exhibit 26 to your deposition. And this is an excerpt of Shirley Couch's medical record.
Okay,
This is your portion, it looked like to me. And the first one is just a patient face sheet, and that's you in the upper left corner with
Okay.
you listed as a medical director. You were the medical director and Shirley Couch was your patient, true?
yes,
And then on referral, do you see that? It reads medical director, James Shiver, MD. You were the referral source.
no,
Object to form.
How does that read, you as a referral?
I think it's just carryover from the previous page.
All right. And then on the next page, which reads 1 of 1, Homestead Hospice and Palliative Care. We looked at a version of this earlier. This is dated June 12, 2017, 7:28:17 p.m. Created by James Shiver. Narrative source, James Shiver, medical director. This is your narrative note. Is that right?
That's correct.
And this is the same note, precisely the same note that's in her CTI, her certificate of terminal illness. True?
That is true.
We reviewed that earlier. Page 4 of 15 of Exhibit 26 is your verbal order.
Yes,
This is order date June 24th, 2017.
yes,
This is for morphine
yes,
and start date June 24, 2017.
that's correct.
And this is in addition to the physician's orders that we reviewed earlier.
This is a modification.
And the modification is what?
It can, if needed, it could be given up to every hour.
Say that again, please.
If the morphine is needed for pain or shortness of breath because of her increased pain that they've been reporting, that it could be given up to every hour.
Yes, sir. And this is a modification of your June 23rd order, the order on the
Yes,
previous day. Is that right?
yes, I believe so.
And page 5 of 15 of Exhibit 26 is another verbal order. Is that right?
And that was 22, yes.
Yes, 6/22/2017, 18/18.
Yeah, it started as a verbal order, and then I think it came to me later as a written order.
Yes, sir. And this is for fentanyl, 50 micrograms an hour, transdermal every 3 days, for pain, read back and confirmed, right?
That's what it says.
And that was read back and confirmed by Rachel McKnight, RN.
That's what it says, yes.
And these drugs were started on June 22nd, 2017.
That was the original order. I don't think they were actually dispensed until the next day. I'm not positive about that.
Yes, sir. You also ordered on June 22nd, 2017 at 18:18 Eastern Daylight Time, Valium, 5 milligrams by mouth, 4 times a day, PRN, take by mouth 4 times daily as needed for relaxed muscles, read back and confirmed, right?
That's correct.
Start date June 22nd, 2017.
Yes.
And page 6 of 15, still Exhibit 26, another verbal order. This is an order date 6/15/2017 at 18:34. This
Okay.
is in addition to the written orders we reviewed earlier. True?
This would be in a modification of the initial 6-2 orders.
All right.
And it's probably in response to a call from Rachel McKnight. I'm not positive about that, but it sounds like, that looks like that's what's happening.
And here you DC the Cymbalta and DC the Tramadol, right?
I discontinued the tramadol because it didn't seem to be working well for her. That's why I was starting the Norco. It's part of a stepwise progression of pain relief.
Yes, sir.
And then the Cymbalta is being, the dose is being adjusted.
Item 3 here, this is when you started the Norco or hydrocodone, 7.5 milligrams, 6 by mouth every 4 to 6 hours. PRN for pain.
That's a typo.
Which part?
6,
What?
the 6.
Well, that's how many you prescribed. I think 6.
Number 6 dispensed. Yeah, that would probably be accurate,
Yeah.
but not to
That's
give,
what's in your written order.
not to give 6 every 4 to 6 hours.
Right.
Okay, yeah, that's correct.
I'm not suggesting that you ordered her to get 6.
Okay, that's what it kind of looked like to me. So yeah, my mistake. I see the punctuation now.
And then going on to page 6, pardon, 7 of 15, still Exhibit 26. This is another verbal order. This is Cipro.
Yes,
Then page 8 of 15, another verbal order. No opioids or benzodiazepines or antipsychotics there, true?
That's true.
And you agree now, you testified earlier today that Shirley Couch never got the Haldol. You know that that's not true, right?
Well,
Objection, cause for speculation.
Join.
I don't know that it was given to her, but I'm pretty sure it was in that comfort kit that you showed me.
Yes,
So it was probably dispensed.
And page 9 of 15. This is your signature reviewing the plan of care we discussed earlier, right?
That is just the bottom of those. Can you scroll up?
Sure.
Is that what that's in? That's one of
Yeah, this
one.
is the last page of the plan of care. It's just your signed version. What there are versions of the medical record that
Oh,
contain your signed, yeah.
yeah, it's 5 of 16. And that's my signature, and it says plan of care, and it's dated 12 June.
Right. And of course, there are
So-
CMS requirements on when a plan of care has to be executed, right?
Executed. I'm not actually sure what the criteria is for actually signing the order.
Well, they have to be approved by you though, right?
Yes.
And you have to be approved within a certain time. Do you know what that time is?
No, I don't, but it's usually,
Objection to the extent it calls for a legal opinion from a lay witness.
I'm not exactly sure what the time is, but we do it as soon as possible. I would assume within 24 to 48 hours, but I don't know that to be a fact.
Fine. And if any time you don't know, just let me know you don't know. Now, the hospice CTI or certificate of terminal illness, we reviewed this earlier, right?
Yes,
And this contains all your diagnoses of terminal illness such that you felt it qualified Shirley Couch for hospice care. True?
I think this is what I felt was adequate to qualify her for hospice care. She had plenty of other diagnoses.
Now, all of which are in the medical record. True?
Yes, that is true. As far as I know.
Well, you didn't rely on anything other than the medical record, right?
That's correct.
This local coverage determination document, what is that?
I don't know. Local coverage.
You need to go back up. It's the last 3 pages of this portion, the portion of the medical record that.
Okay. I just never heard of it as local coverage determinant document. So
You don't know what that is.
physiological impairment, ambulation. It looks like a nursing form that's being filled out.
So, well, you approved this, right? And this your, let's see. Hang on, let me, did you reach your medical director, James Shiver, MD? Did you not see this before today?
I don't recall seeing.
All right. You read coroner's report in this case? Julie Phillips?
No. I did view the deputy cam and heard her talking.
On the video?
Yes,
You agree that Shirley Couch received the bulk of these medications, including the opioids, benzodiazepines, and the fentanyl patch over the course of 4 days?
Objection calls for
Jack.
speculation.
Join.
I have no idea.
All right. You agree that there are over 90,000 deaths from fentanyl overdoses every year in this country?
I have no
Object
idea.
affirmed.
All right. You read Dr. Park's deposition?
Yes,
All right. And you recall him testifying that you provided the terminal diagnosis for Shirley Couch?
did I
Object
what?
affirmed.
You provided the terminal diagnosis for Shirley Couch.
Object affirmed.
I did not, I don't know what you mean by that, provided.
Well, did you read Dr. Park's deposition?
I did, but I don't recall anything about providing any diagnoses. I agreed with his diagnosis that she had worsening cerebral vascular disease that I felt would qualify her for hospice care.
And that was your terminal diagnosis, true?
Yes, that's true.
And you were the physician responsible for Shirley Couch's care from June 1 till June 26 when she was in Homestead Hospice's care, true?
Object
I was-
affirmed.
I was responsible for her hospice care. Dr. Parks, I believe, was still seeing her occasionally, or at least talking to people. I'm not sure how active a role he played, though. I certainly don't think he prescribed any kind of controlled substances or anything other than the tramadol.
Well, not from what I saw. He did not.
Yeah, I didn't think so either.
Have you read any of the GBI report in this case?
I don't recall reading anything from the GBI.
All right. You ever been arrested or charged with a crime?
No,
Were you aware that Renee Bonner was convicted?
Objection calls for speculation.
I heard that she was convicted.
Yes, sir. Did you appear at a bond hearing with other Homestead Hospice employees to show your support?
No,
That's all I have.
I'm gonna have a couple questions, but I need a quick break.
All right.
okay.
5 minutes?
That's
It's fine.
Going off the record at 6:37 PM. We're back on the record at 6:45 PM.
Dr. Shivers, thank you for sticking around today. My name is Felicia Lorraine. I represent all of the other defendants in this matter. I just have a couple of quick questions for you, okay?
Okay.
Earlier, I think you testified that you reviewed Ms. Couch's medical records from Piedmont Athens Regional Medical Center from her June 26, 2017 admission. Is that right?
Yes.
Okay. Are there any laboratory tests or objective ways to determine whether a patient is suffering from an opioid overdose?
No, it's a clinical judgment from the doctor.
Are there urine drug screens available generally?
Yes, they are. I don't recall seeing one.
Is it possible to test the level of a patient's opioid level with a serum toxicology screen?
Yeah, you would be able to get a quantitative evaluation of what drugs were in her urine at what levels.
Mhm. So there could have been a urine drug screen or a serum toxicology screen to confirm a diagnosis of medication overdose. Is that right?
Yes.
Okay. Did you see any evidence in Piedmont Athens Regional Medical Center records from Mrs. Couch's admission from June 26, 2017, that a urine drug screen was completed?
I did not see one. I think I would have if it was there, but it's a long record with lots of nurses' notes. I went through the lab section pretty carefully, and I did not see that.
And that would have been an objective way to quantify how much medication was in Ms. Couch's system?
Yes.
Okay. In your review of Mrs. Couch's medical records from Piedmont Athens Regional Medical Center from her admission on June 26, 2017, did you see any evidence that Dr. Singh or any other physician at Piedmont ordered Narcan or any other opioid reversal medication?
It was not ordered.
Was any are there any benzo reversal agents available?
Not that I know of. At least not in my practice. I haven't seen one.
What are some opioid reversal medications other than Narcan that you know of?
Narcan's pretty much the one that I'm familiar with. I don't do emergency medicine anymore. So they might have other stuff available now.
Okay. Would you expect someone who's in a drug overdose to get an opioid reversal medication to stop the drug overdose?
Yeah, I would say that if they felt she was drug overdosed, that they would do so. I think the dilemma is that it's not necessarily overdose. It was, I think she's saying over-medicated. I think there's a difference. The overdose implies that she has unstable vital signs, that she has respiratory depression, and that they are going to respond to that. Over-medication could just be sedation or somnolence, and that could be actually confusing with having a urinary tract infection and potential sepsis, which could also give similar type pictures.
All right. And in your review of Mrs. Couch's records from Piedmont Athens Regional Medical Center for admission on June 26, 2017, did you see any evidence that Mrs. Couch required life support?
No.
Mouth-to-mouth resuscitation?
No.
Mechanical ventilation?
No.
Airway management?
No.
Intubation?
No.
CPR?
No.
Okay, I think that's all I have. Thank you.
I don't have any questions. He's gonna read and sign.
I don't have any additional questions.
All right, have a good night, everyone.
Going off the record at 6:50 PM.
And Bonnie, standard order. Thanks.
Good night.